Hello, everyone, and thank you all so much for joining us on this year's seminar, the Divine Light Foundation Mental Health Seminar. The theme is Burdens Lifted, and of course, advocating perinatal mental wellness. We are so glad that you joined in today. To all our guests joining us on MixLR, YouTube, of course, on Zoom, we thank you all so much for joining in. And we know that it's going to be awesome. And to everyone, we know, irrespective of your religious beliefs, we are here to learn. And this event has been organized to raise awareness and promote advocacy for mental wellness, especially in disadvantaged communities. I won't say we are disadvantaged here in Nigeria, but we need this, most especially in Africa. Although we are a faith-based, Divine Light is a faith-based foundation, pardon me, the mental seminar is for everyone from all walks of life, irrespective of your religious belief. And we know that it's going to be awesome in the name of Jesus. Amen. My name is Sabrina Osman, and I'll be your compare for today. We have seasoned facilitators here today, and I'm sure you want to learn and learn all the way. I have Kobe Ajayi. We have Funto Oyewale Joy Jegede. We have, of course, the founder, Temi Abiono. So stay relaxed, get your pads, get your pen ready, your writing materials ready to learn, because I'm also here to learn, and I'm sure it's going to be a great time. So get ready. And at the time, I would like to welcome the founder, Temi Abiono, even as she takes the opening remarks. Over to you, Temi Abiono.
Thank you so very much, Sabrina, for the introductions. And thank you so much, everyone, for joining us. It is such a great privilege and honor to have you all here today, gathered together to be here with us. Today, we are gathered to, do some learning, unlearning, and have some time to deal with a serious issue. Mental health is a serious matter. Unfortunately, it has suddenly become the second pandemic in this time that we're in. Last year was very tough for a lot of us, for everybody, I would say, from not getting used to being, locked down and being in one place. We all of a sudden had to adjust to that. We did not understand what was happening, but we've been able to pull through. Unfortunately, some people lost their lives last year. Some things got complicated for a lot of people, from not being able to really manage adjusting to a confined environment, a new way of living. Some people, who were always used to being around others, we all moved to that space where we had to be by ourselves for us to have been able to overcome the great pandemic of COVID-19. We're glad to see that God is helping and things are changing over the years. Well, over the past few months, the vaccines are getting out, all over the place. But sadly, mental health issues has also, you know, um, increased exponentially. And today we are just here to talk about an aspect of mental health that we believe is also very important, and it starts from the grassroots. And that grassroots we're talking about is the family. We want to talk about perinatal mental health, also known as maternal mental health for many. And our focus today majorly is on the Nigerian woman or women in Nigeria. And the reason why we're doing that is because we're just trying to provide support for women in this region who do not have access to many resources as you would have in other developed countries. So this is us lending a support to the Nigerian woman and women in Africa and women all over the world at large. It is known by research that at least 1 in 8 women suffer from maternal mental health issues. And that is impactful. Unfortunately, the Nigerian woman is even in a complicated situation because she has a background that does not even believe that maternal mental health is a big deal. Some people, just say it's, you know, because she doesn't want to, do the things that she used to do before she had her baby. And that's not really the issue. The truth of the matter is that certain things happens to that lady psychologically. Something happens to her chemistry. And if help is not gotten at the right time, it may degenerate. This week, one of my older friends reached out to me when I sent out an invitation to my contact. And she said, this is actually what killed my mother 32 years ago. Honestly, I was humbled. I did not realize the seriousness of it, maternal mental health. I did not know that it was that, serious. I did not know that a woman would lose her life because she did not get help for this. We don't want to have a second story like that. And we're hoping that today you're able to learn something for yourself, for the woman next to you. And, this is not about women, this is for everybody. In my research for this event, I also found out that even men actually deal with perinatal mental health issues. Did you know that? Yes, I recently found out too. And so it affects not just the woman, it affects everybody. And you know why mental health issues needs to be dealt with is because destinies are tied to mental wellness. Your purpose is tied to mental wellness. So if we're not taking care of it, then that means that our world will be ultimately affected. So may this be a call to action for you and I, for us to try to make the world a better place and, do our part in learning new things, unlearning certain things, and being a support for those in need. Once again, I want to thank all our great facilitators here today. Dr. Funta Oyewale, who is joining us from Upstead Counseling in New York. Joy Jegede, she is a clinical social worker. She's joining us all the way from Cincinnati. And we also have Kobe Ajayi. She's founder of Eden Foundation, and she's a maternal mental health professional and a public health professional as well. She's joining us from Texas. And we also have Dr. Liz Adedokun joining us from my home state, Minnesota. She is an amazing mental health professional. She's a certified maternal mental health professional, and she is also a marriage and family therapist as well. So if you have questions as a family, you want to shoot that as Dr. Liz. And we're going to have a smooth ride today. We're going to have an amazing time. Just sit back, grab a cup of tea, a cup of coffee, a glass of water, if you will, whatever would make you comfortable. Grab your notes and let's get on a smooth ride to a better destiny. Thank you for joining us again, and welcome to Divine Delight Organization, the mental health seminar, Burdens Lifted, Advocating Perinatal Mental Health. Thank you for joining us. Over to you, Sabrina. Okay. I think we just got some technical issues with our compare. I'm more than happy to step in. Please bear with me. Let me just quickly grab my notes. Sorry about that. 1 second here. Alrighty. Sorry, I'm just loading my notes real quick. Okay. I'm just going to go through the bio for for our facilitators, and then we'll move on to the show. All right, so I'll start with Dr. Funta Oyewale. Side note, she's been my friend for over how many years? Over 20 years or so. Well, what is 20 years? I mean, since like teenage age. So we go way back, but thank you for joining us, Dr. Funta. Dr. Funta Oyewale is a licensed clinical psychologist. She is the founder and lead psychologist at Upstead Counseling Services. She has a practice that focuses on fostering hope and changing lives through education, consultation, and counseling. She has over 10 years of work experience working on a special division of women in jail, or of women's jail at a state psychiatric hospital, a university counseling center, in churches, and she works with individuals as well. Dr. Oyewale has a unique experience with consulting and educating Christian communities about mental health and illnesses. Dr. Oyewale is a public speaker and teacher. She's an ordained minister at RCCG International Chapel, Long Island, New York. Thank you for joining us, Dr. Oyewale. Moving on swiftly to the amazing Joy Jegede. Thank you so much, Dr. I call her Dr. Joy. Don't worry, maybe that is coming on the way. Joy Jegede is a physiotherapist who is a psychotherapist, not physio, sorry. She's a psychotherapist who is passionate about healing from trauma, depression, anxiety, and panic disorders. She's a licensed clinical social health social worker practicing in Maryland, New York, and Connecticut. She provides trauma-informed and patient-centered, strength-based, and evidence-informed clinical interventions to young adults and adults. Her experience includes providing psychotherapy at outpatient mental health facilities, psychiatrist rehabilitation programs, and primary health clinics. She also established a private practice dedicated to serving persons of African and West African descent. Joy is currently working on her doctorate in social work at the Southern Connecticut State University. And when Joy is not working or studying, she's spending time with her sons and her husband, enjoying a good book with a cup of coffee, or she has her hands creating art or baking something new. Thank you for joining us. I'll move on swiftly to Kobe Ajayi. Kobe Ajayi is a public health professional researching novel ways to close gaps in maternal and child health and maternal mental health. Kobe is a certified Kobe is a certified maternal mental health professional from Postpartum Support International. She's a certified youth mental health first, first aider from the National Council for Behavioral Health in the United States. She's also certified in cognitive processing therapy. Kobe is a mom of two toddlers, ages 4 and 3. Her experiences of having a preterm baby at 33 weeks informed her decision to found Eden Foundation. Eden Foundation is a nonprofit organization registered in Nigeria that aims to improve the health outcomes of mothers and preterm babies in sub-Saharan Africa. She has over 10 years of experience in the corporate industry. Kobe sits on the board of a national nonprofit closing gaps in maternal mental health in the United States. And Kobe has a master's in public health from the Texas A&M University. And she also has a master's in business administration from the Edinburgh Business School. Herod from the Edinburgh Business School in Scotland, United Kingdom. She's currently pursuing a PhD in health education from the Texas A&M University. Thank you so much for joining us today, Ms. Ajayi. And I'll move on straight to Dr. Elizabeth Adedokun, popularly she goes popularly by Dr. Liz Adedokun. Dr. Liz Adedokun is a licensed marriage and family therapist in the state of Minnesota. She serves as the legislative chairwoman of Minnesota Association of Marriage and Family Therapy, as well as the chapter lead for Postpartum Support International here in Minnesota. She obtained a master's degree in marriage and family therapy from Northwestern University and a doctorate in couple and family therapy from Drexel University. Her passion in perinatal mental health is not limited to adolescent mental health, but also to family conflicts and communication and interpersonal relationship issues. She has 7 years of mental health experience working with adolescents and families struggling with anxiety and depression. Outside of her profession, she enjoys spending time with her husband and her two young children. She also enjoys exploring, taking walks, and trying new food. Thank you for joining us, Dr. Liz. It's a pleasure to have you. Alrighty, I'll hand over to Sabrina, who will help us with the next item. Thank you. Sabrina, are you there? Okay. Alrighty. Without further ado, we'll move on to the next item and we'll start with some presentations here this morning. we want to dig into the subject matter, right? Perinatal mental health. And starting us off this morning will be the amazing and the wonderful Dr. Funta Oyewole. She is, uh, like I said, she is the uh, lead psychiatrist at, um, or psychologist rather, I'm sorry. She's the lead psychologist at Ofsted Counseling in New York. And she will start us off on a good note. So hang in here and we'll have a smooth ride. Thank you.
Good morning, everyone. And thank you for having me, my friend and my sister. I'm really glad to be here. Like you said, we go way back over 25 years or so. So I'm really glad to be here. First, I just wanted to talk about mental health in general, and then we'll move into perinatal mental health. So what is mental health, right? So a mental health consists of three different factors: emotional well-being, our psychological well-being, and our social well-being, right? So our emotional well-being refers to how you are aware of your feelings and how you accept your feelings, and what you do with them. It involves being attentive to your thoughts, your feelings, and your behavior, just whether they're positive or not, being aware of that. And then your psychological well-being refers to a feeling of purpose or meaning in life. It also refers to your personal growth and development. And then your social well-being refers to the extent at which you feel a sense of belonging to your community or your society. So all these three areas are under the umbrella of mental health. So your emotional well-being, your psychological well-being, and your social well-being, how you interact with other people around you, how you interact with yourselves, and how you're aware of your thoughts and your feelings. So our mental health affects how we think, how we feel, and how we behave. This in turn helps us to determine how we handle stress, how we relate with other people in our lives, and how we make day-to-day choices. Mental health is important in every stage of life. Whether you're a young person, you're an old person, it's a part of who you are. Unfortunately, a lot of times when we talk about health, we focus so much on our physical health and we ignore the mental health part of it. According to the World Health Organization, there's no health without mental health. Because if you're not well mentally, it would definitely impact your physical health. It will impact the choices that you make, which will in turn impact your overall physical health. So like I said, mental health is important in every stage of life, whether you're a child, you're an adult, you're a grandma, your grandpa, everyone's mental health is important. So it helps us to be able to function effectively in our day-to-day activities, whether that's work, school. As we're talking about today, perinatal mental health. When we're well mentally, it helps with how you take care of your children, right? How you show up as a mom, as a wife, and as a member of your society. So we've talked about mental health. What is mental illness? So mental illness refers to a condition or disease that causes mild to severe disturbances in your thoughts and your behavior and it really impacts your ability to cope with day-to-day demands and routine. And what happens is, we all know, life can throw curveballs at us all the time. So when you're mentally ill, your ability to function day to day will be impacted. So mental illness is any condition that impacts your thinking, your feeling, or your mood. So we've talked about like a general overview of what mental health is and what mental illness is. Let's talk about what is perinatal mental health. So this refers to a woman's mental health during the perinatal period. And we know that the perinatal period is from pregnancy to about a year after you've had the baby. That's the range of the perinatal period, right? So it really refers to that a woman's mental health during that period. And perinatal illness, on the other hand, refers to any psychiatric disorder that is prevalent during the pregnancy and during that perinatal period. I think Ms. Abiona mentioned earlier that, about one in 8 women will suffer from some kind of mental disease during the pregnancy. According to the World Health Organization, for underdeveloped country, it's that range is actually one in 3 to 1 in 5 women will have some kind of mental health difficulties during the perinatal period. So it's pretty common. It's very common. Unfortunately, a lot of people go undiagnosed because we attribute these symptoms to, well, this is just what happens when you're pregnant. You know, everybody gets tired, everybody's sleepy, you know, people just have poor mood when they're pregnant. And when we miss out on these really important symptoms that could be signaling the problem, which is quite unfortunate, because when we don't address these issues on time or as they show up, it can, you know, get exacerbated and worsen. The conditions can get worse, and it would impact the mother's health and also the baby's health also. Um, so let's talk about some of the common myths about perinatal mental illness. Sometimes you hear that, you know, baby blues is the same thing as perinatal depression and anxiety. That's not actually true. Baby blues are, you know, happen to about 80% of mothers, and it usually is milder in comparison to perinatal depression, right? It's mild, and it often resolves itself in a week or two, where the mother is back to normal, feeling better. So baby blues is kind of due to hormonal changes in the body. It's not the same as perinatal depression or anxiety. Perinatal depression anxiety is more severe than baby blues, and it lasts longer, and it actually impacts the mother's ability to function in her day-to-day activity. There's another myth that it can only happen to um, people who are poor, or another thing I hear when I go to talk to people, like, oh, Africans never get, you know, Africans don't deal with mental illness, we're strong. That is not true. Perinatal mental illness can happen to anyone, whether you're rich, poor, Black, Chinese, Indian, whatever. It's a equal opportunity condition that can happen to anyone. Doesn't matter whether you're educated or not. So it's high time we need to start paying attention to those symptoms and taking action as quickly as we can, as soon as we can. Um, I don't have my slides, so I'm going, I can't see what I'm saying here. So another thing is that, you know, people who are pregnant are in good health, or, you know, we need to remember that hormonal levels changes when we're pregnant, and that can cause, you know, mood swings and things like that. Again, like I said earlier, some of these things are normal, comes with a part of being pregnant, but we need to pay attention. If it's starting to last longer than usual, it's impacting our day-to-day function, and that's something we need to stop and pay attention to. We know that pregnancy is very stressful. If you've ever been pregnant before, it's not fun. Sometimes it can be very stressful. And we get all this tiredness and mood changes and stuff, but we need to pay attention. If it's starting to last longer and it's starting to impact our functioning, that's something we need to reach out and get help for. Another myth out there is like a woman is a bad mother or a weak mother if she has perinatal depression, anxiety. That is a big fat lie. Um, you know, any woman, like we said, is, as long as you're a woman and you're pregnant, you're at a risk for getting some kind of perinatal mental health issues. So experiencing that does not mean that you're weak or you're a bad mother. It's just part of the package sometimes, and due to many different factors that we'll talk about later. Um, Another myth out there is postpartum depression is long lasting and it's forever. Actually, it's not. As long as treatment is gotten as soon as possible, it can be really temporary when you get treatment, and it's treatable with professional help. So, like I said earlier, it's important to start to take action as soon as we see that there's a problem, and not just kind of sweep it under the carpet and say, you know, it's just one of those things. The earlier we get help, the better it would be. Um, so let's talk about some common conditions. If we can move on to the next slide, please. It'll be slide 8. Okay, thank you. So some of the common conditions that people experience, mental illnesses that people experience during the perinatal period, could be antenatal, prenatal depression and anxiety. This is depression, anxiety during the period of pregnancy. And then we have postpartum, after the baby's born, depression and anxiety, postpartum anxiety or panic disorder, postpartum obsessive compulsive disorder, postpartum PTSD, and postpartum psychosis. Is some of the common conditions that people experience during the perinatal period. So real quickly, because I don't have a lot of time, we're going to talk quickly about some of the warning signs to look out for. And again, when we talk about warning signs, we need to look at the context, right? Don't just say, oh, I'm irritable today, there's something wrong with me, right? I'm mentally ill. You need to look at just the context. Is it affecting your day-to-day functioning? How long has it been present? So some of the warning signs to look out for, having a persistent, sad, anxious, or empty mood, being irritable, feelings of guilt, worthlessness, hopelessness, or helplessness, loss of interest or pleasure in things that you used to enjoy doing before, feeling of fatigue, tired, abnormal decrease in energy. Like I said, when you're pregnant, you don't have a lot of energy anyways, especially when you're in your third trimester, right? But if it's more than usual, if it's an abnormal decrease in energy, then that's something to really pay attention to. Feeling restless or having trouble sitting still, having difficulty concentrating, remembering things, or making decisions are all warning signs. So go to next slide, please. Difficulty sleeping, even when the baby's sleeping. We know after you bring a baby home, there's not a lot of sleep happening. So even if the baby's asleep and you do have time to sleep and you're still having difficulty sleeping, that might be a warning sign. Staying awakened early in the morning, or oversleeping, having an abnormal appetite, weight changes, or both, aches or pains that you can't really explain, having a trouble bonding with your newborn child, or having difficulties with forming an attachment with the new baby, having persistent doubts about your ability to care for the new baby, thoughts about death, suicide, or harming yourself or the baby. These are all important warning signs to look out for. And then next slide, having excessive worry, panic attacks, repeated thoughts or images of frightening things happening to the baby, having delusional thoughts. These are thoughts that are not based in reality, seeing things or hearing things that other people cannot see or hear, or having disorganized thinking. All these are kind of symptoms of perinatal psychosis. So these are all very important things to look out for. And again, like I said, think about it in context. Don't just say, oh, I'm feeling irritable today, so something must be wrong with me. Look at the whole picture of what's happening. So let's talk about some of the risk factors for perinatal mental disorders. There's social factors, there's psychological factors, and biological factors. Some of the social factors could be socioeconomic status. Like if you're pregnant and you don't have a lot of money, you don't have a lot of resources, that can, be very stressful and can be a risk factor for mental illness. Exposure to trauma, whether trauma in the past before you were even pregnant, trauma during the pregnancy, or trauma during the birth of the child. All these things are risk factors. Negative life events, domestic violence. A lot of women are in domestic violence situations. And some of these, that's also a risk factor. Poor relationship with your partner and poor social support, not having a lot of people that you can talk to or reach out to for support during the pregnancy period. Pregnancy can be really stressful, and we need all the help that we can get, all the support that we can get during that period. Reproductive intention, was the pregnancy planned or unplanned? That could also be a risk factor. If it was unplanned, like if it was due to a rape, for instance, or it was on a planned time, baby came at a time that was inconvenient. These are all risk factors, social risk factors that can impact one's mental health during pregnancy. Some of the psychological factors could be the mother's personality traits. So is this somebody whose personality is just kind of neurotic, just anxious all the time? That's a risk factor. Prior psychopathology, is this someone who's suffered from mental illness in the past, whether it's depression, anxiety, substance abuse? These are all risk factors. Increased stress also can be a risk factor. Pregnancy is stressful as it is, and there's now added on stress from outside, that can add to the stress that the mother is feeling already, and that could be a huge risk factor. Let's talk about biological risk factors. What the age of pregnancy can also be a risk factor. Is this person a young person, and this is their first child? That could be a risk factor. Genetic and hormonal susceptibility. Is there a family history of mental illness, perinatal mental illness? These are some, risk factors. Chronic medical condition, or is it a severe medical condition? Is it chronic? How long has it been happening? And then pregnancy complications. Complications during the pregnancy can be a risk factor for mental illness during pregnancy. And then number of pregnancy. Is this your first pregnancy? Is it planned? All those things can add on to that. Or if you had 5 kids already and then you have this unplanned kid and then it's like 7 children now and you're like, I don't know what I'm going to do. All of these are risk factors that can really impact a mother's mental health during the period of pregnancy. So perinatal mental illness can be a reemergence of something that was a condition that was already present before the mother got pregnant. It could be a reemergence of the same symptoms, or it could be exacerbated during that period, or it could be the first time ever that woman is experiencing mental illness. Okay, like I said before, it can happen to anyone. So it's not only not only happens to people who have a history of mental illness. It could be that person's first episode of mental illness during pregnancy. So it's something that can happen to anyone at any time, any mom at any time. And I think Ms. Abiona stated earlier that even men, even fathers can be impacted by this. So it's something that we need to be mindful of and pay attention to. So what are some of the impact of perinatal mental illness? So perinatal mental illness does not only affect the mother, it can also affect the baby as well. And I believe Dr. Liz will be talking a little bit more about that as we go along. But some of the things that it can impact the baby being born prematurely. It can cause low birth weight for the baby. It can cause a disorganized attachment with the child after the child is born. Because when you're mentally ill, like I said earlier, it impacts how you show up, how you behave. So it can cause a disorganized attachment with the baby and the mother after the baby is born, and can cause impairments in the child's general cognitive development, and the child could be at risk for emotional and behavioral difficulties in their childhood if they have a mom who's dealing with mental illness. And lastly, what are some ways to foster mental health when you're pregnant? Self-care. Got to take care of yourself. Your diet is very important. We don't spend a lot of time thinking about that. I remember when I was pregnant, I'm eating for two. I'm just going to eat whatever is placed in front of me. That's not very healthy. We need to pay attention to what we're eating when we're pregnant, because diet plays a very important role. Sleep. Make sure you're getting enough sleep. If you need to ask somebody, if you need to delegate some of your activities, as mothers, we do a lot. We're responsible for this, for that, and the other. If you have to delegate some things, don't be afraid to ask for help. Get that sleep. Sleep is very important. Exercise. You don't have to go to the gym and run and jump. Just sometimes taking a walk, going up and down the stairs. Exercise is very important for your well-being mentally. So get that in. We've talked about rest and relaxation. Take some time out to rest. And then social support is also very important. Don't be afraid to ask for help when you need it. Speak up when something is not happening, because the sooner you speak up and the earlier you get help, the better it would be overall. So ask for help when you need it. Say, which goes to to the next thing: stress reduction. Find ways to reduce stress in your life. Set boundaries in service of your well-being. It's okay to say no. I've always done this for you guys, but now this is a very important period for me and the baby I'm carrying. I'm going to say no to this. Learn when to say no. Set boundaries in service of your own well-being. Take time to stay mindful. Take time out to just relax and focus on your breathing and pay attention to what's happening in the present moment. Take deep breaths. Just take time to relax and rest. And then lastly, check your worry. A lot of things that we get worried about are things that are not happening right now. And we spend so much time and effort and energy worrying about things that are not happening in the present moment. So when you start to notice that you're getting worried and things like that, just stop and check with yourself. Is this something that's happening right this minute? If the answer is no, let it go and focus on what's happening right now. If the answer is yes, it's happening right now, it's a big deal. What can you do about it? Make plans to get it done, and then move on from it. So these are all different ways that we can foster perinatal mental health for mothers who are pregnant. Thank you. That's all I have. And then I'll be happy to answer questions as we go along.
Thank you so very much, Dr. Funta. That was really great. Um, really appreciate that. We're going to move on swiftly to the next person, our next facilitator. Um, Joy Jagede will come up to talk about systemic changes that support perinatal mental health. So over to you, Joy.
Hi, do you see me? Do you hear me?
I can hear you.
Okay, so I'm unmuted. Do you hear me now?
Yes, I can hear you.
Okay. Hi, everyone. Thank you for joining us today. Thank you, Dr. Funto, for that background. That was very helpful. So I'm going to go forward as a social worker. We like to look at things from a systemic perspective. So on to my first slide. Can I change the slide, please?
No,
okay.
yes.
Yeah. Thank you. So I will be talking about 4 different things. I'm going to try to rush through the first 3 because I'd like to spend some time on the 4th. And the 4th is because I think we will benefit from learning some practical tips on how to manage depression and anxiety in the perinatal period. And for anyone who's watching, basically. So you cannot look at yourself as a unit. You will do yourself better service to look at yourself as a unit in concentric expansions of different units, and you're just one of them. And that's why this figure is trying to show us that you're an individual in a social network. There's institutional impact, there's a community impact, and there's also the public policy impact. So looking at perinatal mental health, the way I want to examine this is to look at first the microsystem, which is you as a person, what is going on with you and your immediate family, the people who live with you. If you, with your husband, your children, if you have children before the baby. So that's the microsystem. The mesosystem will be the extended family. Anyone else outside of you that is a group of people, that's the mesosystem. It could be business, work, church, mosque, healthcare providers, community. And then the macro system, that is the law, the culture, and policies that determine how we're able to show up as individuals. And then, like I said, I want to spend more time on the last slide, which is self-regulation practices and wellness tips. So next slide, please. Yes, this one, thank you. No, microsystem, yeah. So I would like to introduce us to what microsystems, the way I like to look at it, talking about you, I want to look at you as a product of your genes plus your environment. We show up based on our genetic compositions, right? We all know about genes, the unit, tiniest unit of life that encodes your DNA, and that determines how you show up. Just like Dr. Funta said, your genetic composition could predispose you to anxiety and depression and the like. But there is a factor, a piece of it that we don't see sometimes, and that is the environment. The environment that you find yourself and that you create for yourself can impact your genes. And that is what we mean by epigenetics. Epigenetics mean, it's a term that describes how genes plus environment can continue to shape us up until, I think, till age 80 or something like that. We are able to keep changing your genetic, your DNA, your makeup, because if you focus on your environment, it can impact your genes. So that's one part of it. The other part of it, in the microsystem, meaning you as a person, your hormones play a huge impact. And we're talking about serotonin, oxytocin, I didn't put that in here, oxytocin, serotonin, the cortisol, and the adrenaline, the epinephrine and norepinephrine. So the way all of this interacts can help us understand better how these hormones and the environment can impact how we show up as people. Thank you for this slide. So just reading, epigenetics and hormones in your body can result in perinatal illness or support perinatal wellness. So your mood can be impacted by your genetic makeup, right? So like I said, I missed one out, that's oxytocin. Oxytocin is a neurochemical that impacts how a person is relaxed and receiving care or ability to provide care. And it is produced in the brain and also in the heart. That's where oxytocin comes from. The other important neurochemicals to note are serotonin, and it's very heavily indicated for depression. Cortisol, very heavily indicated for stress and anxiety. Epinephrine and norepinephrine, just can simplify and say adrenaline, very heavily indicated in anxiety and stress. So the goal here is to help us understand how all of these neurochemicals come together to impact our perinatal mental health, plus your environment. So if we can look at it from that perspective, then maybe we will be able to make some changes that we can at the basic level, which is starting from the microsystem, the mesosystem, and the macro system, which is maybe sometimes out of our control, but the micro and macro, we may be able to do something about that. So for the purpose of this presentation, I decided to start with the meso and macro system. And remember, the meso and macro system, these are the group of people or anyone outside of you and your immediate family that is not quite the culture and the community and the society that is a mesosystem. So you in the mesosystem, if you're here and you're listening to this, you may say, well, I'm not pregnant. I was pregnant years ago. This really has nothing to do with me. But I want to challenge that. I would like to ask you to think about what I showed in the first slide, how you is a unit, and then the meso, and then the macro. What that means is what spills down will affect the micro person. That's the person that we're concerned about, who is the perinatal, the woman who's pregnant. So think about it for a minute. I'd like to go to the next slide. So think about it for a minute, please. Whoever you are in this space listening to this, I'd like you to take a minute and just reflect, some self-reflection, and ask yourself, what are my biases? What are my cultural beliefs? What am I bringing to the table when I see a person who's different or changed, or who dare to express herself and say, I don't feel too good when they're pregnant or when they just had the baby? This self-reflection is so crucial to us being able to make a change, to be able to support other women in this quest to promote perinatal mental health. You may say, well, I don't, I'm very supportive, but the truth is we all have biases. We encode biases implicitly without even sometimes even knowing it. Sometimes a person comes into your space. What is the first thought you have about that person? You look at a person and you sum up who they are based on what you see. But what you need to realize is the conclusions you're making about that person, it's because of your bias. And bias is real, it's a thing. So I'd like to invite you here in this space to think about it. Just take a minute. Think about your biases about mental health. Think about your biases about pregnant women who are struggling. Think about your biases about people who express that they have some difficulty. That's the first change we need to make. I cannot change what I don't own. So I'm inviting you to think about and change or expand your thinking to accommodate other people and how they go with life, how they express themselves in their lives. So that's self-reflection. The second point that I think will be very helpful for people to know is how to generate oxytocin. Remember how I described oxytocin at the beginning, that it is a very important neurochemical. We hear about it even in the ward when we're having the baby. Sometimes when a woman is having difficulty, they give her oxytocin so she can contract quicker and harder and push out the baby. Oxytocin is such a healing, it's a healing neurochemical. It's physiological mechanism for healing, and it heals the body and the soul. And you could be asking yourself, so what does oxytocin have to do with me? The beautiful thing about oxytocin is you can generate oxytocin for yourself and for a woman who is in the perinatal period, because it helps with reducing stress. It helps with making people feel better. It helps with reducing the blood pressure, and it also increases a sense of well-being. And like I said earlier, oxytocin is generated in the brain. It's also generated in the heart. And that should make us think twice about it. Why is it generated in the heart? Because it promotes calm, peace, love, well-being. So how do you generate oxytocin as a person in the mesosystem, hoping that it trickles down to someone in the microsystem? And that is a person that we're talking about today. A kind word, a smile, being understanding, a hug, expressing empathy, um, being kind to the women who are pregnant or who just had a baby. When you do that for them, you're generating oxytocin for them and in them and for yourself as well, because you can't give what you don't have. So generate oxytocin, be kind, be patient, be loving, a smile here, a touch here, a hug here. Kindness will go a very long way. And that takes me to the next point, which is withhold judgment. The language that we use can be very it could set a person up for more stress and depression and anxiety. So the key here is removing anything negative from what you're saying. So even if you notice that someone around you isn't doing well in the perinatal period, don't say what is wrong with you. That term wrong can increase the feeling of guilt and shame for a person. How about asking them, what is happening to you? That is being more non-judgmental, being open and accepting. And when you speak like that, like the way I said it, what happened to you? You're helping the person feel, I can talk to you. And then when they start to open up and talk to you, be present. Um, um, and one thing I've heard and learned about our culture is how a person will be like, oh, what you're saying, something worse than that happened to such and such and such. We need to cut that out. The fact that it happened worse for someone else shouldn't minimize my own experience. So just listen. And if you don't have anything to say, just give them a hug and tell them, I understand and I will be supporting you any way I can. And then we normalize mental health treatments. If a person is not able to cope, it is okay to seek out medical treatment for your mental health. It is okay to seek out psychiatric treatment for your mental health. It is okay. It's the same thing as it's equivalent to a person who has diabetes and they try to control their diet. If it's not working, what should you do? Seek out medical help. So it's on the same category. We should do our best to destigmatize anyone who decides to seek mental health treatment. So next slide, please. Okay, so now we've talked about the meso. Now I'm moving to the micro. And the micro, I'm talking to the women on this platform who are listening or who will be listening, who are either pregnant or just had a baby and they're feeling off kilter. So this is what I'd like you to do first of all. I'd like to start by asking you to participate in something we call interoception. And I'd like to link that to what Dr. Funto talked about, where she talked about risk factors. And like I said earlier, you can't change what you don't know, and what you don't own, you can't do anything about it. So interoception, it simply means taking your eyes and turning it inward. and scan yourself. Ask yourself, what is going on with me? What are my triggers? What are the things that set me off? What has changed about me? Accommodating, like Dr. Fonta said, don't take one symptom and isolate it and say, oh, I'm irritable, so yeah, something is going on with me. No. Looking at the big picture, you know yourself. You're the only one who knows yourself best. So looking at the big picture and scan yourself and turn your eyes inward. And also for physical mental health symptoms, you can also check yourself. You can start from your feet and just check with you, how am I feeling? How does my knee feel? How does my thigh feel? How does my hip feel? How does my stomach feel? How does my chest feel? My back, my neck, my head. Do a scan of your body. You will find that when you turn your eyes inward, you will start to see things about yourself that no one else can tell you. And when you do that, we call that top-down regulation. But the problem with top-down regulation is when a person is overwhelmed by these hormonal changes, they're not able to do top-down regulation because already their nervous system has already taken over and they're feeling so depressed or so anxious. So what do we do now? I'm still on the, please, could you please go back to the last slide? So when we do top down and we're not able to, because we're so overwhelmed by our nervous system, that's when we switch to bottom up regulation. So bottom up regulation is very simply, we're going to try to regulate our autonomic nervous system, but with the purpose of bringing up what we call your parasympathetic nervous system. And that is the state where you're calm and relaxed and you're able to think. Because this is what happens. And I'm going to show you a little visual with my hands. So using, this is called the brain in the hand. So we know we have, your brain has three parts, right? The hindbrain, midbrain, and forebrain. So using the brain in the hand analogy, this is your hindbrain, this is your midbrain, this is your forebrain, right? When we get overwhelmed by emotions, mood swings, anxiety, stress, what happens is our thinking brain, which is what makes us unique as humans, the thinking brain goes offline. And all you do is the person begins to act based on only their midbrain and their hindbrain. And that is when the person gets anxious. That's when we have those chemicals that we talked about at the beginning, the norepinephrine, the epinephrine, the cortisol. It comes online and the person becomes supercharged and they become so sick and it gets worse and worse. So what do we do to help us bring ourselves down when we are feeling this way, when we are hypercharged and the thinking brain went offline? We won't be able to bring it back online. Next slide, please. And this is it. This is where we have to do the work. We work on overcoming depression. And then when we're not able to, when the depression persists, after all this kind of interventions, then it's time to seek psychiatric help. If you feel severely depressed, severe anxiety, suicidal thoughts, psychosis, you need to seek mental health treatment. But I thought to teach just these two tips to help us to learn how to, by yourself, manage feelings of depression and anxiety. So the first one is, like I talked about, interoception and scanning yourself. Learn to know what your triggers are. What are the things that have changed about you? So when you do that and you're able to identify them, then maybe you can start to address changing the things around you in your either the micro system or your meso system that could help you be able to overcome and come back to being yourself. And then another tip that can be very helpful is what we call behavioral activation. Behavioral activation, I chose this because I thought it was something people can do by themselves. And it's evidence-based. It may seem simple, but it works. So this is how behavioral activation works. When a person is depressed, they don't have energy. And when they don't have energy, like Dr. Funta also said, the things you used to do before, you don't do them anymore. You don't feel like doing them. But what happens? The depression gets worse. So how do we break this vicious cycle of depression? You have to do something. And if there's only one thing you remember from this presentation, from my set of presentation, it is fake it till you make it. And I'm going to say that again. I need you to fake it till you make it. And how do you and when you write all these things down, pick the easiest one and start. When you push yourself to do something that you used to enjoy, what's going to happen is a lot of changes start happening in your brain. First of all, you feel a sense of accomplishment. You start to feel some pleasure. And that sense of pleasure can release oxytocin into your body again. And when that happens, you start to feel better. And the more you start to do something that you used to like and you keep doing it, you'll find that you increase efficacy. And who knows, you may go on to the number 2 and then number 3 and number 4. And then little by little, you find yourself coming back to who you used to be. So that's one good tip I'd like to share today to help folks here to learn how to manage depressive symptoms in the perinatal period. It may seem like, oh, I'm overwhelmed. I have the baby, I have my other kids, I have work. It could just be something as simple as playing a game on your phone. If it's something you used to like to do before and you haven't done it since you had the baby, if you try to push yourself, remember, fake it till you make it, push yourself, do something, it will work because that's the science of behavioral activation. Next slide, please. And this is where I would like to introduce you guys to, remember when I talked about palming your brain in your palm? This, and this. So this is a skill that can help you bring this back online. And it is called, first, let me deal with the one, the diaphragmatic breathing. Oxygen, it's free. It's a resource that is free. And all you need to do is remember to breathe. The problem with breathing is we breathe wrong. Majority of us, even myself for the most part, we're all chest breathers. And when we're breathing from our chest, it's like we're activating that hypervigilance and hyperventilating because we're not taking in the oxygen enough to where it should be to make enough difference in your forebrain. So what do? We ask people to take in the air, say breathe in for 3 counts, hold it for 3 counts, and then breathe out for 5. That's a simple way to do it. So I'm going to demonstrate, and I'd like you to, you could set alarms on your phone, or you could tie to an activity you do several times in a day. You could tell yourself, when I go to the bathroom, I will breathe diaphragmatically, using that as a cue until it becomes a habit. So this is how to breathe diaphragmatically. And just, if you want to join me, I'm going to do 2 sets of it for time. If you want to join me, I'll use my fingers to prompt us. So 1, 2, 3, 1, 2, 3, 1, 2, 3, 4, 5. So So when we do that, it helps to bring your forebrain back online. And when you bring your forebrain back online, then you can think and you can start to ask yourself, so what am I worrying about? Is it worth it? Is it something I can change? Is it something I have to leave? Is it something I have to act on? Your problem solving skills begin to come back and you begin to be present in your body, in a relaxed body, and address the things that are stressing you. So that's one way to help yourself deactivate the excess stress and mood change hormones that overcome us when our thinking brain goes offline. So the other part is called progressive muscle relaxation. And it's based on the premise that when a person is anxious, what happens is we squeeze our bodies up. So the idea behind progressive muscle relaxing is to allow yourself to squeeze it by yourself and then release it. So if I had enough time to walk you through, which I don't, but there's a script here that can help you. So first of all, you take a couple of deep breaths and then focus your attention on a part of your body. I prefer to start from your feet and work your way up. So squeeze your toes, 5 seconds, release. Your calves, 5 seconds, release, and work your way up like that. Your chest, your shoulders, your back, your face, your facial muscles, everything. You squeeze for 5 seconds and release. And then you do the final squeeze. You hold your whole body, squeeze it for 5 seconds and release. and you will feel the tension start to dissipate. So these are tips that can help folks here who are in the perinatal period for your mental wellness. Being aware that you cannot look at yourself just as a person, as an individual. You have to look at yourself as a system, and then work through the impact of the system, starting from your self system to your immediate system. And the challenge for other folks here is generate oxytocin. Don't be judgmental. Be kind. Speak a kind word. Be understanding. Be empathetic. And hopefully, we can help our pregnant women and young mothers go through the period of their lives with less stress. Next slide, please. I think that is the end of it. Yes, thank you very much.
Wow, thank you very much, Dr. Joy Jegede. That was practical and very insightful. I truly appreciate it. I'm also learning. So I learned that I can generate oxytocin. So can everyone, let's just use this practical, let's just practice this in a bit. Can everyone just turn on the camera? I want to see your face because it's time for us to generate oxytocin, a smile. So if you can, I want to see your faces. Yeah. All right. So let's just take the 60 seconds to just smile and just generate that oxytocin. And that is so amazing. And she said that we should fake it till we make it, create a list of what you love to do, push yourself to do what you enjoy, because it actually increases efficacy. Thank you very much for that, Dr. Joy Jegede, once again. Thank you, thank you. All right, let's move to the next presentation by Dr. Lizzie Adedokun. Over to you, ma'am.
Thank you. I'm hoping I can still share my screen because I don't know what happened to the slides. So, oh, okay, great. Thank you. Sister Joy and Dr. Funcho, thank you so much for your psychoeducation for all of us. It was beautiful, and it really kind of, helped with my presentation. I have a brief overview of just kind of what was discussed earlier. So if you don't mind going to the next slide, and I will do my best to keep this short. So, when we think of pregnancy and the maternal period, we see these beautiful maternal photos on social media. We see it in the movies. So pregnancy is just this beautiful thing. But, the perinatal period can also be very scary. It could be anxiety provoking. It could be daunting. And especially for new mothers, it could be overwhelming, right? We have all these thoughts of, oh, I'm going to be this, first time mom, and I don't even know how to give birth. And, oh, I'm experiencing some pain I've never felt before. And overall, this period can be emotional, like we talked about earlier. It could be emotional because our hormones are all over the place, right? And if we are not able to manage our emotions, like Dr. Funto said, we can have an increased risk of developing some of these common perinatal mood and anxiety disorders. And so 1 in 5 new mothers actually experience some sort of mental health challenge or experience during this period. And I won't go into too much detail, but here's just the list of some of the common perinatal mood and anxiety disorders, or PMADs is what we call it, that Dr. Funta has given us some details about. So we can go on to the next slide. I just kind of want to talk a little bit about how a woman's or mother's mental health can really affect her infant, right? But some of these, risk factors and things that, the mother can deal with include suicidal thoughts. So this is actually a leading cause of death during the perinatal period. And so if you're ever having any thoughts of harming yourself or harming your baby, or if you're feeling like you don't, want to live anymore, that is a huge warning sign to seek help. I actually, as introduced, I work with a lot of mothers right now who really struggle with depression, and it's substance use is also a common thing that I see too, using marijuana or other drugs, and this can actually have negative impacts, on your physical health and also with breastfeeding. if a mother is not able to manage her emotions or, you know, manage her mental illness, this can also reduce her ability to respond to her child's needs, right? This baby is depending on you for life, right? For food, for comfort, for safety. And if we are not able to manage our emotions, that could be really hard to be present for our babies. We could also feel disconnection from the baby if a mother is dealing with psychosis. That mother may not even feel like she knows the baby or feels unfamiliar, and that can be scary. And also, women with PMADs can feel isolated, can feel alone. And I think that's why presentations like this are so important, just to really remind yourself that you're not alone, that a lot of us, 1 in 5 new mothers, are dealing with some sort of mental health challenge during this period. And that can also lead to feeling guilt, right? Or shame, like, well, I'm this mother and I have this baby and I'm supposed to be this, you know, all together and perfect to, you know, be the best mom I can be. But again, everyone, mothers, fathers, grandparents, we all deal with some sort of mental health challenge. So if you are feeling that guilt or shame, it's always good to seek help. So impact on the infant. So children can definitely have an increased risk of psychological and developmental disturbances or disorders when one or both of the parents, I'll talk a little bit about fathers soon, is just emotionally dysregulated. This could lead to the infant having a difficult temperament, right? Just not being easily soothed, can be colicky. They could have emotional or cognitive delays. One big one, I'm a huge advocate of attachment. So I'm really happy that Dr. Fonta talked about attachment security. So if a parent is able to, you know, respond to their baby's needs in a warm and validating manner, that child will start to learn who they can feel safe with, right? Who they can feel emotionally safe with, they can know that they have a reliable source for their needs. However, if that infant you know, has a mother where, you know, they're not reliable or they're inconsistent in meeting that baby's needs, that baby can actually form an insecure attachment and not know when to, you know, seek their parent for help or for comfort. And if your baby is fostering or having this insecure attachment, that can actually increase the risk of the baby developing mental health disorders. There is a such thing as infant mental health. Infants have feelings too. So, and they can also, as they grow into adolescence, they can also struggle with disorders such as ADHD, depression, anxiety, and also suicidal ideation. So, if we have to be, you know, well enough to be able to help our babies regulate their emotions. Next slide, please. Oh, this is my favorite slide. I am a huge advocate for inviting fathers. So all my pregnant mamas out there who are going to the appointments, invite your husbands, invite your partners. It's super important. Men are actually at an increased risk of mental health problems. We typically don't focus a lot on fathers, which I believe the focus needs to be on fathers as well. 1 in 10 fathers actually suffer with postpartum depression. That may be surprising for some of us, but fathers, as stated before, also struggle with postpartum depression. And research has actually shown that the impact of their child's emotional and behavioral development can be influenced by their father's mental illness. New fathers also don't, you know, they're not able to access the sort of services that like new mothers do. So we see like doulas and midwives and, you know, even OBs really kind of focusing on the mothers. And that's why I said before, it's extremely important to invite your husband or partner into the room with you, for them to really be able to be in this experience with you. And also, it's really important for fathers to be screened for mental health illness during this period. There is also a relational impact. There is research that has actually confirmed that marital satisfaction does significantly decrease after the first baby. There is research on that. And we can often see men shutting down or maybe experiencing rage. And that shutting down is really important to pay attention to, because we may think, oh, my husband just doesn't want to help. I'm the only one with the baby. But sometimes if your husband is just kind of on his own or playing his little video games, typically that could be a sign of postpartum depression. So it's really important to look out for that. Of course, marital problems can come up before or after baby, but it could be really significantly increased after the first baby, because everyone's just tired and stressed. And so I'm so happy that someone brought up, leaning on your social support. I like to say leaning on your village. Who are your people that you could just call to come and help you? And also, I noticed with fathers I used to work with, not really knowing how to help the mom, right? Like, especially from new moms who are breastfeeding, fathers may not know how to insert themselves or help. But that's why they have bottles, right? If you are kind of wanting to pump or rest, that's what your husband or partner is there for, to kind of step in and bottle feed. So that's that. I like to talk about the community, especially when we talk about the OBs, the mental health professionals, pediatricians, even doulas and midwives that work with mothers, to really increase the mental health screening. I don't know about you, but I know when I was pregnant with my children, I remember being bombarded with screenings, right, for depression, anxiety. There's a PHQ-9, there is the GAD for generalized anxiety disorder. There's also a specific screening for pregnant mothers. So it's really important to be doing those screenings early on and over the course of the pregnancy. It's very important. We also need to be teaching mothers that there's tools out there, right, to address these issues. There's support groups, there's mental health therapy, there's parenting classes, right? It's really important for both mother and father to have access to those tools. We can also reassure mothers that these emotional challenges we're facing are treatable, right? This is not a permanent thing, especially with our hormones fluctuating up and down. It's treatable with the right help. You can definitely, help with these emotional challenges. And it's also important for the community to just remind mothers that in order to best take care of your children, you have to take care of yourself. And we've heard this early on in our presentation. I'll talk a little bit about self-care at the end. And we can move forward to the next slide, please. So overall, perinatal mental health is super important. As stressful and painful as it can be, we can enjoy pregnancy. We can enjoy motherhood. It's a beautiful gift. I don't know about you, if there's new mothers out there, as soon as your baby comes out, as soon as you see your baby face to face and they, place that baby on your chest, it is honestly a love that is just, it's completely unexplainable. I can't even explain it. It's beautiful. And in order for us to enjoy the messiness, the challenge, right? We just feel more fulfilled. We feel more full. We feel more like, yes, I can add value to my life, right? And we can prevent avoidable suffering and isolation by leaning on our village, leaning on the people that we can trust to call, and they can come over and bring a meal or come over and help, with the baby. And I know Dr. Funta said earlier, catching these potential concerns early on is extremely important because it can help with just help long term. And lastly, children can have a healthy start and a healthy attachment to thrive later in life. That attachment is super important. If we are fostering a very healthy, secure attachment and we are present for our babies, we're consistent, we're reliable, we're able to help them manage their emotions and their feelings, you're actually doing them a favor, right? But as they get older, they will be able to know how to manage those tough emotions that we all face. They'll know how to, have high and healthy self-esteem. They'll love themselves. They'll feel like I am worthy of love. I'm worthy of care. So all of that starts early on. Next slide, please. So self-care is important. I say this to all of my clients. You can't pour from an empty cup. fill yourself all the way up to the point where it's even overflowing. Anything overflowing can be left for a loved one, your baby, your husband. You have to take care of you first. I always say that self-care is not a selfish thing. It's actually very necessary. You need it in order to be present for the people that that you love. I know that we've all have traveled, right? So we've all been on an airplane where they say, in case of an emergency, you have to put your oxygen mask on first, right? They say that for a reason. You take care of you first, then you help, your loved ones with their masks. Then you can help them, right? But if we are so dysregulated and we are just really struggling with our emotions, of course it's going to be hard to be present for our babies, right? I always encourage my clients, especially my moms, to eat foods that are rich in protein and fiber. There's benefits for these types of foods for the brain, right? They kind of strengthen our neural pathways. Rest your body when you can. I know with new moms and new babies, sleep, a full night's sleep is very hard to come by in the first few months, but when you can, rest your body, right? Practicing mindfulness. Oh, Sister Joy, I'm so happy that you were able to. I actually did it along with everyone. The mindfulness activity, deep breathing. We do a lot of chest breathing, and we don't take into effect that the deep breathing is actually good for regulation. It helps regulate our system. Move when you can. I tell my moms, I'm not saying to go back into the gym and start working out hardcore. Taking a walk in the neighborhood is simple and good enough. Prayer is really important too for those of us who, our faith is important to us. Whenever you're feeling down or stressed, I definitely find that prayer can decrease some anxiety and stress. So I think that's the end of mine, but I want to share a little bit of resources for the next slide. At the next slide, yes. So Postpartum Support International. So I think I and maybe Sister Joy. I'm sorry. I'm probably forgetting, or Sister Kobe. Certified. We're actually certified through Postpartum Support International. This is actually the biggest resource line for any postpartum support. They have a helpline. It's free. I always tell my moms to take out their phones, save this number in your phone, call anytime. They even have a line for Spanish speakers if you are needing support. They also have a directory if you're looking for a specific therapist who is certified in perinatal mental health. I'm actually on that directory. There are a number of support groups out there through PSI. You can just go on this website. I'm hoping that this information can be shared with our audience later on. Go on this website. They're free and they're virtual. You can literally plop on your phone in your bed while breastfeeding your baby. I actually lead some of those groups. I lead the pregnancy groups every second Wednesday of the month. And I also sometimes lead the Black Mamas Connects groups. That is on Tuesday evenings and Sunday evenings. So please, 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 I'm always advertising for these groups. They're extremely helpful. The members that come to these groups every week just find it so helpful. So, and again, it just kind of reminds you that you're not alone on this journey. There's also, I found this amazing resource, the Mental Health Innovation Network, and they're all about advocating for perinatal mental health. I totally invite you all to browse their website. They also have a long list of resources as well. So there are resources out there to help you all. So thank you. I think that is the end of my presentation. I am so looking forward to the questions and comments that people have at the end. Thank you.
Thank you so much, Dr. Lizzie Adedoku. I really, really enjoyed that and I learned a lot. So what I'm taking home, take care of yourself. Self-care is important because you're worthy of love. So I am worthy of love. Thank you so much. All right, then we'd like to welcome Dr. Kobe Ajayi, even as she shares a personal experience. Over to you, Dr. Kobe Ajayi.
Hi, everyone. Nice to be here. My name is Kobe. First of all, I am not a doctor yet. I am pursuing a doctorate. I like to always make that distinction. I feel like I'm being set up, like having to go after these amazing speakers. I don't know if I can meet up or I don't know. Dr. Funto, thank you. Joy and Dr. Liz, amazing, amazing. I thought it was best to give a story a short story about my own experiences having my baby in Nigeria. Although we are all in the US, so sometimes it might feel like, oh, we're outside of, we're in a different space where it seems kind of culturally more responsive to such issues. So I want to bring my story more like situated in the broader perspective, and while still having some empirical knowledge or information to back up my story. So I am talking about traumatic birth experiences and maternal mental health. Let's go to the next slide, please. I'll give an overview, which is what is a traumatic birth experience, the impact of traumatic birth experiences, and what we can do. Next slide, the very, very short one. So given a direct quote, what is a traumatic birth experience? It is an event occurring during the labor and delivery process that involves actual or threatened serious injury or death to the mother or her infant. The birthing woman experiences intense fear, helplessness, loss of control, and horror. So what was my story? My story essentially was I had a preterm baby at 33 weeks in Nigeria, particularly at Gariki Hospital in Abuja, Nigeria. It was unplanned in that I had gone through my I did not know I had placenta previa until 31 weeks that I started bleeding. Now, prior to this time, the pregnancy had been smooth, and this was my second pregnancy. I had gone for my anomaly scan and everything was superb, until I noticed I was bleeding, and it was just bam, bam, like it just went through very fast from there. And it was after that, before then, I had no idea, no inclination of what's mental health, talk less about maternal mental health. It was something that nobody talked about. Nobody mentioned it. Even during my antenatal care visits, nobody mentioned there's something called, everybody was just focused about having your baby. The whole topic is about the baby, not practically about the mother. So as you can see from the slide, there are prenatal factors, which is past prenatal mental health issues. So the previous guests facilitators have already talked a whole lot about issues, past prenatal mental health issues. So I'm not going to dwell on that. There's the issue of child sexual abuse, which is something that is still, again, those are things that prenatal factors before having the baby itself, or history of a traumatic birth experience. So that is, for someone like me, I already had a traumatic birth experience. If I want to have another baby, there's still the chances of me having another traumatic birth experience, because maybe I have to start thinking about what happened in the last time or stuff like that. So we have circumstances of birth, which is painful labor and delivery. Again, my delivery was, I had to go to the hospital. I was rushed to the hospital, and 3 a.m. in the night, and it was during that period, the National Hospital, they were on strike. So we trying to look for hospitals that would accept me at 33 weeks, and no, at 32 weeks, because I went to the hospital at 32 weeks and eventually had my baby at 33 weeks. So trying to get that, all those processed, I was in the hospital, and eventually I did not only have placenta previa, I ended up having both PROM, which is pre-rupture of the membrane. So it was something really I didn't expect. And even delivery type, I had a CS. It was an emergency CS. Some people don't want to have CS, for instance, not just, again, there's the issue of the societal stigmatization around CS and the limited knowledge about women who give birth through CS, they're weak. So when there is that sudden shift, there's the whole, Dr. Joy already mentioned a lot about the oxytocin, serotonin, and all of them and how it works, right? So when there's that sudden shift, we don't get what we want, it actually affects our experiences, and it can lead to having some kind of, which is a traumatic birth experience, and it can lead to having a mental illness or issue. So, or when there's a high medical intervention. Now, a medical intervention here might be as something as maybe there was a condition during maybe the mother lost a lot of blood, or there was a near miss or a near death experience. So those are that the mother they had to rush the mother to the ICU or things like that, that she spent a lot of time at the hospital. So those are things that actually still causes poor mental health amongst mothers. Subjective factors. Now, the subjective factor is, again, like it's subjective, meaning we as an individual is the way we perceive it. We all want to feel heard. We know the issue of disrespect and abuse. It's common. We've heard a lot of it in Nigeria, where nurses are making some really derogatory statement or comment to the woman while she's giving birth. While we might think that, oh, did my mother not go through that, or did Mrs. A not go through that? Was there, or maybe some people be like, it's needed so that the woman will be strong. The woman is too weak. It actually registers in the brain of the woman as I'm being powerless. Like, I can't make a decision for myself, or someone is talking down at me at the most vulnerable point in their life. Already at that point in time, like Joy mentioned, is a time where the hormones, or Joy, Dr. Funto, and Dr. Lizzie already mentioned, there's a lot of hormonal changes around that period. So when it's exacerbated by this, maybe our nurses who do not appreciate or who talk down at us while we're trying to give birth at a very vulnerable stage, it increases our poor mental health amongst mothers. Then there's the issue of lack of support. Every one of us has mentioned support. Support cannot be underestimated. Support here is not just from the family members or from friends. Support can also be from when you don't have support from your team, which is the medical practitioners who are caring for you during your baby, when you're giving birth. You've heard stories of women who get to the hospital and they're just lying there, nobody is attending to them, or they're seeking to explain something like, okay, what's going on, and nobody's talking to them. Those are things. So those feelings that we have as moms while we're giving birth are valid and should be taken into consideration. So when you feel like, so don't feel, oh, I shouldn't, it's okay, maybe someone is talking bad at me, or stuff like that can affect our mental health as well. In my own case, I said I was going to infuse my story within the presentation. In my own case, I've had miscarriages before. For some people, a miscarriage is a traumatic birth experience. But for me, it wasn't, because it's subjective. It depends on how you feel, like how that situation, how it came about. For me, it wasn't. I had 2 miscarriages. So it was like, okay, I felt bad, but I was able to get over it without any support, without anything. But having a preterm baby, for me, was my breaking point. Some people have a preterm babies and they still don't have any of all this. Like they're still fine. So that's why it's subjective. That's why we are all different. So whether or not, for some people, it might just be because their birthing plans did not go as it was supposed to go. For instance, there's COVID-19 now, and there's so many changes. You can't come to the hospital you have to wear a face mask. For some people, it might just be wearing the face mask. The stress of being constrained to doing what they really did not want to do. So that's why it's subjective, and there's a long list. But the truth is, no matter what that person or a mom is feeling at that point in time, it is really important that we are aware of all the things that Dr. Funto, Joy, Dr. Liz have mentioned. They are very important. When I had my baby, after having my baby at 33 weeks, thankfully, we didn't have to do it. The CS went very smoothly. It wasn't as planned, because the projection from the doctors was I was going to need pint and pint of blood, because I had already bled out a lot. But thankfully, that didn't happen. My baby spent only 7 days at the NICU. And again, that was immediately, I didn't see my baby for two days after giving birth to her. So she didn't breastfeed, and we all know how that first kangaroo care is very, very important, not only for the baby, not only for the mother-child bonding, but it's very important for small and sick newborns to improve their thermal regulations, right? So I didn't get to see my baby for 2 days. I didn't even know what she looked like. I didn't even touch her. And the first time I saw her after 2 days, I started crying. I didn't want to touch her because I was already a mom. So I already had a full-term baby, and I was comparing in my head, like, what is this? This is not a child. Like, this is not me. And I was 100% healthy all through the pregnancy. I'm a healthy freak in quotes. I'm trying to make sure that so those are things that can come in that happens during the whole process of that can inform or affect our mental health. So it was this my combined experiences of having a preterm birth and an unplanned preterm birth, and the whole caring for a preterm baby is another whole ball game on its own. It's not enough to say you're at the hospital and you've cared for your baby. When you're now at home trying to feed that baby, I was feeding my baby with a syringe, whereas my first baby was just a walk in the park. So trying to see the baby grow, as the baby was very tiny, I always used to say my baby didn't have a bump when I had her because the back was flat, it was just a line, right? So it was a very, very trying time for me to see that, how do I care for this child? How do I get the support I needed to care for this child? My mom had never cared for a preterm baby, so everything was new for all of us. I barely slept. For the first 1 year, at least I barely slept because you have to feed that baby every other hour. That means I was practically awake because how do I fall asleep? I'm not a bulb that you just say, oh, when the baby sleeps, you sleep. It doesn't always work. So that's the whole, that was my story of having a preterm baby. And that was how I ended up wanting to be, I knew there was something wrong, right? I would cry myself to sleep. I was blaming myself for having a preterm baby. I was constantly blaming myself, like, no, it was my fault. I did something wrong. So these experiences during, I think I was about 3 months into when my baby was about 3 months, that was when I knew there was something wrong because I wasn't myself anymore. I know that if I had gotten, maybe if I was diagnosed, I'm 100% sure that what I felt, from what I know now, what I had then was postpartum depression. I'm 100% sure because that's a problem again, because we don't have qualified people who we can speak with. We really don't know what we're dealing with. That's why times presentations like this really matter, so that we can educate ourselves about this prior to at least giving birth, so that we know when there are changes within our body and our system, we're able to identify, hey, this is what is wrong with me. Because ignorance is the worst disease that can ever happen when you actually don't have an idea about what is going on with your body. Anything goes. You feel like, oh, it's normal, or you keep on blaming yourself and keep increasing or making the whole problem worse. So what did I do? Next slide, please. For my, sorry. So the impact of traumatic birth experiences. From here, I'm not going to touch on poor mother, infant interaction and relationship, because already Joy and the other speakers have already touched on that. Post-traumatic stress disorder, poor relationship with partners, I'm not going to talk about, but I'm just going to talk about breastfeeding and fear of challenges, because the other speakers they've already hinted points in this. So breastfeeding and breastfeeding challenges. For a preterm baby, I'm using preterm because that was my experience. For someone else who have had another kind of traumatic experience, maybe a stillbirth, you can imagine at that point in time, the breast is already engulfed, there's already, the milk is already out supposedly to flow through, right? So there's that challenges that could come, but I'm going to, like I said, I'm using my experiences. My experiences having to breastfeed was really, really hard because she wasn't able to suckle. My daughter wasn't able to suckle. She was not developed enough to suckle. So I had to use a breast pump. Now, in the hospital I gave birth, it was so sad. And that was what actually informed my whole decision to start my nonprofit, because I saw all the mothers manually using their hands to press the milk out of their breast. And it was so painful to them. You could see the strain on their breast, like the marks. You could physically see the marks from continuously pressing the milk, their breast, to bring out milk to breastfeed these infants. who at this point in time are unable to suckle. So having to put a milk in the syringe, having to be careful and all those challenges, and not even the whole idea is when that experience comes, when there's that traumatic birth experience, it detaches you from the baby. And part of detaching you from the baby is not wanting to even feed the baby. And there's the whole idea of fear of having another child. I won't lie to you. Initially I was saying I wanted to have 3 children, but after having my second child, I told myself, I'm done. I'm not. It's not because I know that I don't want to go through what happened the last time, because already the science is there. They'll call, I always used to jokingly say, they'll say I have a high risk previous pregnancy and my age, and I don't want to be a statistics. So rather, I have 2 daughters already that I'm going to, if I want children, I used to say, if I want children so badly, I'll adopt. But that is me. And that's the truth. There's that. So when we have a traumatic birth experience, there's that no wanting to have another child, not even wanting to be it's just a whole compounding issue. And like I said, it's subjective. So this is just a few of the lists that are there. It's usually subjective. There's now the cultural side of it, where you need to deal with societal misconception and myths of not even knowing about these experiences. So going back to what I said, like, so what did I do? How did I get support to manage myself and to be where I am today? And that will be my last slide. Next slide, please. So what can you do? I mentioned earlier, educate yourself about maternal mental health. This is so, so, so key. Like, if you educate yourself about, there's a lot of resources out there to just be aware. The truth is, just imagine you're pregnant right now and you're trying to, no, let me know it's pregnancy. Just imagine that you go to school. We all have some form of education, even if it's just primary level education. But the truth is, we get exposed to a part, maybe a topic, or they teach us something. And at the end of the term, we are expected to write an exam. If we don't go through the class, if we don't go through the first 3 months, we don't attend the classes, chances that we would not do well in the exam is high. So that's something as simple as an analogy like that is, if we're not aware of our mental well-being, if we don't know that these are the things that would happen, then it's going to be an issue, right? So for me, what I did was, because I really didn't know about it, I had to seek help. And who did I seek help from? Not from my husband, because he had no idea what was going on too. We were both ignorant in the whole situation. I'm using the word ignorant, like we were both we didn't know anything about it. So I spoke with my cousin, who is a medical doctor. She's just she's an ENT, which is, she's even specialized in ears, nose, and throat, not necessarily a prenatal or even an OBGYN. But she has the medical knowledge already. She knows. So it was her who first made me understand what was going on with me. She just told me, she said, Kobe, you know what's going on with you right now? You are slipping into depression. And I need you, like, I don't know how you will do it. I'm here for you. I need you to brace up. This is not the end of the world. Trust me, your baby will be fine. She's fine already, but you're the one overthinking this. So I knew I'm a Christian. Sometimes we'll be like, oh, we'll just pray it away. No, it's not enough to pray it away. We need to speak to someone. I prayed, and I was still having the feeling, I'll be praying and I'll be crying, right? I'll be praying and I'll still be hating myself. And I'm like, there's something going on. I don't know what's going on. Like, because I used to always pride myself that I'm a strong person. I have experienced so much in life that I thought, come on, I'm able to pray things to say, no, what I tell myself, Kobe, this is okay. This is not the first time it's happening to you. I tell myself that, but this one, I couldn't tell myself anything. There was no amount of thing I was telling myself that was working. So I had to speak up. I spoke to my cousin, who is a medical doctor. So there's always that one person in your cycle. Don't look for somebody who will tell you to, oh, it's nothing, you're overthinking it. No. Just even if it's someone who you know that this person, there must be that one person who is able to tell you the truth. To say, okay, you know what, I think something is really wrong. Let's look for a solution together. And it was my cousin's continuous speaking to me, encouraging me, reminding me that it was not my fault, because I kept telling myself it was my fault. And I kept thinking that my baby would never grow past that stage. I thought she won't even be healthy. Today, she's a 3-year-old child that is on my case. Like, she's even fatter than, she's bigger than her older sister. She's everywhere. She does everything. And sometimes once she's talking, I'm like, oh my goodness. You get, but at that point in time, it felt like the world was over for me. And I couldn't see beyond that time. So when we have that experience, when we go through whatever it is we go through, because during delivery and during our birthing period, we should speak up. We shouldn't feel bad. We shouldn't be ashamed. Yes, I was ashamed to even talk to my husband about it. That's the truth. Not only did I not want to talk to him, not only did he not know about it, I was ashamed to talk to him about it because I felt he too used to always pride on my behalf that I'm a strong woman. So I'm like, I don't want him to see me as the not strong woman anymore. So I had to speak to someone who I felt I could be more vulnerable to and understood me. Again, seek help. The help might be a medical professional directly, or a friend, or a support system, a support group. Today, there are a lot of support groups. If you go to Instagram, there are lots of support groups on even within the Nigerian community. There are lots of support groups even on Telegram that you can join and ask for support. Don't be afraid to ask for support. Again, this might sound so cliche, like don't be afraid to ask for support. But the truth is, I know sometimes we are afraid to ask for support. But let's not be the superwoman. There's no superwoman here. There is no superwoman, because there is no need. I always used to selfishly say this: we come first, not our babies, not our husband. We come first as women. If we don't show up for ourselves, if we're not alive and well, trust me, the people who will think they come first, they would even suffer the most, because we can't even be our best to them. So we come first. So ask for support, no matter how it is, even if it's sending an anonymous message to a group so that they don't know you first, just to even get that feeling that you won't feel judged. Ask for support. Again, ask your doctors and nurses as much questions as you can. Don't feel that, there's this issue that, especially in Nigeria, I'm going to situate it within Nigeria. I'm trying to be very quick here. Sometimes we feel like, oh, the doctor has told me this is it. So the doctor said it, it's okay. If you don't understand, ask questions. It is your right. You have the right to know the kind of drugs you're taking, why you should take them, what is going on, is there any side effect? You have to know, because when Google, the internet is good, hallelujah. But if you're not careful with your searches on the internet, you might search the wrong thing. So what other best option do you have? Seek professional advice. So in general, I would say a traumatic birth experience, it's different for everyone. I understand I have to respect I try my best to respect the fact that not every mother actually wanted to be a mother as at when they became a mother. Some sadly were raped. Their pregnancy was as a result of rape, whatever kind of rape it is, but that is the truth. And I have to acknowledge all those experiences, which actually contributes to a poor mental well-being. So at any point in time, please seek help. Despite your condition, despite your situation, please seek help. There are very good resources available online. Dr. Joy, Dr. Lizzie, and Dr. Funto, I'm sure we are all available if you ever need to speak with someone, to send a message or something. And I just want to thank again Abiona for this opportunity. Thank you very much, and I hope you are enjoying the time so far. Look forward to questions.
Thank you very much for that boldness, Dr. Kobe Ajayi. Indeed, I really learned. That's the truth. That was an excellent presentation, if you ask me. Thank you so much. A big thank you to all our facilitators, Dr. Funto Oyewole, Dr. Joy Jagade, Lizzie Adedokun, and of course, Dr. Kobe Ajayi, pardon me for that. That was excellent, insightful. I learned so much and I'm still learning. And not to forget that this seminar is basically for, it's an awareness, it's a mental awareness for people in Nigeria. And so I'm glad that I'm here, that I'm learning. And you made mention that sometimes you just go to the hospital and they will ask you, those nurses, they go on to ask you, are we the one that put you in this position and all of that? But thank you for that. So without wasting much of your time, we're going into the questions and answers right away. And we have a couple of questions. And so I want us to quickly, I want to call on my facilitators to please help us. Dr. Funto Iwole, Joy Degede, Dr. Liz Adedoko, and of course, Kobe Ajayi. I want you all to please help us with this. So thank you, thank you. Thank you for coming on. You all look beautiful, by the way. Dr. Joy, you're so beautiful. Dr. Lizzie, wow, your smile. Thank you so much. And of course, Dr. Funto, amazing. I love your hair, by the way. All right, so let's quickly get into this. I would like to ask Dr. Funto, we hear of mothers abandon their newborn in Nigeria. We have a high rate of children being abandoned at the roadside, at the bin, the refuge places and all. Is this majorly a mental health matter, or is just a personal issue?
Yeah, thank you. I would say, so I think mental illness is a personal issue. I would say yes to both, because when you're mentally ill, it affects all you do. It affects how you feel. It affects how you behave. So I would say it's both, because when you're mentally ill, it becomes a personal issue. And I would maybe say that a lot of the women who do this are probably struggling with mental illness, because when we're mentally well, even though things might be stressful, we're able to reach out and get support to say, okay, I can't handle this kid or this child. It's too much. Can somebody help me? But when we're mentally ill, we're not able to reach out and access the support or the resources that we have. So I would go ahead and say it's probably highly probability that it's a mental health issue. And like I said, when it's a mental health issue, it's a personal issue also. So I would say yes to both.
All right, thank you for that. Dr.
measured in terms of the time, how long it's been, and the intensity. We use a DSM to diagnose, and with the DSM, you could have like 10 criterion put down, and they will say if you meet 6 of those, then you qualify for a diagnosis. So if a person has 2 of the 10, then they're not there. It's not even suboptimal yet. I would just ask that people be mindful of um, how long have they felt this way, and how intense, how serious is it? Um, how much of their lives have changed as a result? What is the level of change in their functioning? And how do you do that? By practicing interoception, being aware of yourself, checking with yourself, being honest with yourself. And like Kobe said, that subjectivity, what was hurtful or painful for someone may not be painful to someone else. So know yourself, know what matters for you, to you, and put your focus on changes around that so you can monitor yourself. You're the best person to be able to tell yourself what is going on. Your treatment team listens to you. It's so subjective. Mental health, mental illness is so subjective. So intensity, length of time, changes in functioning. For me, those are the 3 things I pay attention to in order to say this is just a challenge, not just this is a challenge, or this has become a disorder.
Thank you very much for that. I truly appreciate you. To you, Dr. Funto, I want to ask this question. Is it possible to have a mental health condition and not be aware?
Yeah, so yeah, that's possible, especially if you're coming from a culture where there's lack of poor education about mental health or lack of knowledge about mental health and mental illness. It's possible to be struggling with some mental health condition and not be aware of it. And that's where the community, the village kind of comes in to be able to say, you know, these are the things we've noticed. This is what's going on, what's happening with you, you know, how can we support you through this? Do we need to get you some help? So it's not just left to the individual, because if you just leave it to the individual, the person might, you know, say delusions, for example. The person has this delusional belief, they believe that it's true, and nobody can tell them anything about it. So it might take somebody else from their community, a family member or a friend, to say, you know, these are some of the things I've noticed. So these are the ways that it's affecting your functioning. Maybe it's time to, you know, talk to somebody about it. So it is possible.
Awesome. Thank you for that. Dr. Lizzie, this
Is anyone else hearing feedback, or does she?
is for you. Can you hear me?
Now I can. Sorry. You could. Yeah, I couldn't hear.
Okay, so sorry about that. Okay. What are some common symptoms of depression people overlook?
What are some common symptoms of postpartum depression, I would assume, that people overlook? You know, I would say, I mean, the overview of some of the symptoms are like low energy, fatigue. I think a lot of people may overlook fatigue due to just it's normal, you know, to feel tired during that period. But if you are feeling like you just want to sleep all the time, that can be an indicator of depression. I know what someone mentioned before, having like a loss of interest of things that you used to do. Again, some people may think that's normal, like, well, I don't have time to do, you know, what I used to love to do because I have a new baby. But that can definitely be an indicator of depression. There's definitely symptoms physically, like, you know, changes in appetite, changes, of course, in your sleep hygiene, your motivation level, right? It's like you may just not feel motivated to do things that maybe you should do or you used to want to do. So those are some common things, but fatigue, I think, is a big one because people think like, oh, that's so normal. Of course, you're not going to sleep, but, you know, typically if we're just not sleeping at all, or we're just like sleeping too much and just we've handed the baby over to the nanny and we're just in bed all day, that's definitely an indicator of signs to look out for postpartum depression.
All right, because here in Nigeria, when you're going through all of this, it's like, oh, sleep. You need all the sleep. Oh,
Yeah.
maybe she's not eating well. Let's make some pepper soup for her. And you know that you're really going through all of this. So thank you for that. Sometimes we go through all of this and we really don't know that we're going through depression. Even as a young lady here in Nigeria, you go through all of this, but you really don't know. So this is actually a serious case, and I'm glad we're really talking about it. And I'm so happy because next time they may say, oh, let's resort to prayer, like Dr. Kobe mentioned earlier on. All right, to you again, Dr. Lizzie, can perinatal mental health problems be hereditary? Can it be hereditary? Can it be passed from one generation to another?
Oh, most definitely. We all, as clinicians, as mental health professionals, we're always assessing for family history, right? Family history of mental illness, especially unresolved mental illness, can definitely increase your risk of developing those illnesses as well. I often, when I work with my mothers, I often hear about their own attachments, right, to their own mothers. When they become mothers, that starts to come up for them, like, oh, well, my mom didn't do this or that. That can definitely come up in this period too, but it could surely be passed down. We hear, generational curses and those generational patterns. I do something that is called a genogram, like a family tree, where the clients are actually able to see, in person, just kind of those patterns that are passed down, right? Some our behaviors are learned, right? So if, we're not talking about mental health in our family and really working to resolve those, it could surely, be learned and passed down for sure, for sure.
Awesome. Awesome. Now I know. But is it common? Must everybody go through this postpartum depression?
That's a tricky one because I know there's 1 in 3 to 5 women develop postpartum disorders, depression being the most common. But I think Joy, I love those 3 areas that you mentioned: the severity, the intensity, the duration. If it's really impacting your functioning, that can definitely be diagnosed. But I do believe, due to the fluctuating hormones and just the whole experience can be very stressful, most definitely your mental health can be impacted. It may not be diagnosed right away, but you can definitely have those symptoms. And again, I'm saying I believe every mother. I don't know any mother that doesn't feel stress or sadness at some point. We all, whether we're pregnant or not, we all feel sadness, right? We all feel rage sometimes. Those are normal emotions that God has given us, right, as human beings. So most definitely.
Okay, because I know of a friend that whenever she's pregnant, she always cries. She will just start crying. I'm like, no way, I don't want to go through this. I'm not that emotional. But anyways, thank you for shedding light to this. To you, Dr. Joy, again, any relationship between mood swings and mental health illnesses?
Mental illness are actually mood swings, or maybe call them mood changes. So that's the very straightforward answer. But again, to be qualified as a disorder, you have to look at how long has it been that way, how intense. Because sometimes a person can have a dip in their emotion and they're able to come out of it like pretty quickly. But if a person has a dip, and the dip could be an explosion or a depression, it could swing either way. So if a person has a dip in their emotion and they stay there, not when I say stay there, in no way am I trying to say that a person makes a choice to stay there, but they're powerless to make the changes to come out, and they stay there for longer than that is maybe culturally acceptable. Personally, maybe a person's standards for how I want to be, how I want to present myself, and they're not able to meet up to that personal standard, and they stay in that depression or that explosion or that anxiety, then that mood swing has become mental illness. So yes, there is to me it's the same thing, but it's again, predicates on the intensity, the severity, and the duration.
Awesome, awesome. Thank you very much for that. To you, Kobe, I want to ask you this question because you had your baby in Nigeria. Um, and sometimes they don't even allow the men to come into the labor room with you or the theater. So how can men support wives, sisters, friends struggling with postpartum issue?
Yeah, thank you very much for that question. I think you're right with not men not getting into the delivery room, which I honestly, I think maybe if we had a nurse or a medical practitioner who is practicing in Nigeria, maybe they might give a reason why they have this, why they put such laws, because I have no idea why that laws, why it's common in Nigeria. I can't actually say it's a law. But the truth is, when you say how can fathers or partners or friends and family support a woman, first of all, I would say be aware. It's a systemic thing, so it's not just the mother as a whole. I wouldn't like to take the mother away from the equation. I rather want it to be a part of a system. So just imagine if maybe while you were in school, you were educated about women's health. And while you were educated about women's health, you got to know that women are naturally, without even being pregnant, are two to three times more likely to have a mental health depression, to have depression than men. If we're able to know the distinction between women's health and men's health, that makes women more predisposed to major higher rates of health issues, which includes depression or poor mental health, then we're able to support them better. So it's not just it's you can't just take a tree and just start tending to the tree from the leaves up when the branches, or rather the roots, are not well situated on the ground. So we need to look at it from a whole view, which is systemic, trying to make sure that we educate parents, educate fathers, educate mothers, and try to break the societal stigmatization or the societal belief that women or modern, in quotes, modern women are just trying to use the whole mental health as an excuse. After, did my mother not go through that? So when we're able to educate, when education is there, more education needs to be there out there, and I think other people can support better, because if we don't educate them, then they can't support. It's not enough to just say, it's difficult for a woman who is just barely understanding herself, the whole changes, everything is going on, to now try to educate a man who has that notion, that already held belief that a woman mental health is an illusion. So at that point, it's only going to bring up more fracas between the both of them. So when we educate, make it a societal education, not so, for instance, occasions like this, men should be here. When men hear, they understand more, they listen more, right? During antenatal care visits, men should, or partners should go with their wives. They are more exposed to what's going on versus being outside it and trying to see it from the outside. So I think that is one way, aside from the whole policy changes. I think I'm a bit, I tend to want to like policy a lot, because when there's a policy, chances are there's some kind of implementation that will go on. So when there are more policies, making sure that the mental health policy or the space in Nigeria accepts and does not see, like you mentioned earlier, that if somebody says they want to see psychiatrists and they're mad, don't see it that way, but try to understand that mental health is as important as a physical health. Yeah, I think that's where I'll come in.
All right. Thank you so much for that. All right. Thank you very much. To you, Dr. Lizzie, you made mention of the things that people should go through to be aware that someone else has got issues. What are those things you think we should be aware of for those people that were not there when you mentioned that? What are those things we should be aware of when a sister needs help or is struggling with mental issues?
Sure. I think it really just goes back to those symptoms and warning signs that Dr. Funta kind of helped us, explain, right? If we are, just having low energy or feeling gloomy, if we are just worried about every little thing, that we're to the point where we can't, control those worries. I know a big one that I think I mentioned when I was talking about fathers is rage. Sometimes we overlook because we are, we're tired and we're functioning off of little sleep. We can, just snap off on our partners, our husbands, and sometimes even our babies. That definitely happens. And so I love that Sister Joy really talked about just doing that body scan, just doing those, continuous check-ins, right, with your body. Check in with how you're doing. Maybe do that every hour. How am I doing, mentally, right? So those are some pretty important things to look out for. But I think the biggest thing is that if it is impacting how you are functioning, right? If you are not able to pump your breast milk, if you're not able to just, kind of sit down and have a meal, if you're not able to just to focus, those are really some important things to look out for. I hope that answered the question.
Yes, absolutely. That does. Thank you very much. So we have some few messages from you, the YouTube people who are watching us at the moment. Someone asked and said, what are some of, okay, how can you tell if someone isn't mentally healthy, and how can you help? That is to Dr. Funta.
Okay, I think we kind of talked about this earlier too. Like, if you're starting to notice changes in their functioning, and you think about it in context, right? Has there been a change in their mood than what is normal for them? Are they more sad? Are they more hyper than usual? How long has this lasted, and how is it impacting their functioning? Is it impacting their function at work? Are they able to focus at school? What, caring for their kids? Are they able to care and provide for their children? Things like that. So these are some warning signs that we need to look out for. I guess, and your question is, how can we help? So I always start out with a conversation, like talk to them, just see, like I think Joy mentioned, don't come in and say, what's wrong with you? How come you haven't been showing up at work? How come you haven't been feeding the kids, right? Just come to them and talk to them. These are some of the things I've noticed. What's happening? Do you want to talk about what's going on? Initially, they might say nothing, but if we keep showing up from a genuine place and showing that empathy, one thing I've realized because I do talk to a lot of Nigerian churches a lot, one of the things I realized is we tend to be quick to be judgmental. Like, if I try to talk to you first couple of times and you're like, nothing is wrong, I'm fine, I'm just like, yeah, whatever, go figure it out on your own, I'm trying my best. But we need to understand that, when someone is struggling, it can be really hard for people to open up and, trust you, because maybe they've trusted somebody in the past and the whole neighborhood heard their issue. We need to keep showing up and be genuine. And those of us that are showing up to support, we also have to be responsible with what people tell us. That's not the time to pick up your phone and call the whole church members or the whole neighborhood. Guess what's going on with this person? She can't even take care of a kid. You know how we could get sometimes. We need to come from a place of empathy, from a place of care, and just keep showing up. Look, I care about you. You matter to me. I just want to support you through this. And so these are some of the ways that we can start to help people. You don't have to be a psychologist or social worker to know how to help. Just being present, showing empathy, showing genuineness, and genuinely caring, and say, what do you think will be helpful? How can I help you? What, and even sometimes just saying how can I help you too might be, some people might not want to reach out and get that help. So sometimes just thinking practically, what might be helpful for this person? They just had a baby. So you can call them up, I'm going to the grocery store, I'm going to the supermarket. Do you want anything? Can I pick you up anything from there? Or can I bring you some food? Can I come watch the baby while you sleep? These practical things can go a long way. I hope that answers your question.
Yes, it does. Here in Nigeria, we need to hear that, because that's when they will start telling you, oh, you can't take care of your baby. And you're so, we really, as much as possible, I want to be real this today. Here in Nigeria, we find it so difficult to confide in people, because that's when people will go all out to talk about you. You can't take care of your child. You can do this. But with these few tips, I'm sure that will infuse a fact that you really care. What can I do for you? Can I come watch the baby? Can I go to the markets for you? That really helped. Thank you for that. Thank you so much. I'm learning, by the way. Thank you for that. All right, to you, Dr. Joy. Can problems solve mental health issues?
I think Kobe wanted to say something, if I'm right.
Okay, Kobe, please go on. Go on.
I wanted to add to, thank you, Joy, for catching that. I wanted to add to what Dr. Funto mentioned, right, about taking care of the whole. So sometimes we as women, this is unique to us. Sometimes we tend to, especially when we give birth, when our friends come in, we want to be nice, we want to cook for them. It's okay not to cook for anybody. You just had a baby. And it's okay to tell them nicely before they come. It's okay. The truth is, nobody owes you anything, right? So it's okay, or rather, you don't owe them anything to please anybody at that point in time. You're vulnerable. That is the truth. So it's okay to send them a message. See, when you come, if it's okay, but if you can you please help me make X, Y, Z? They should help. They shouldn't, your friends shouldn't come and sit down as Lord of the Universe. Okay, I have come, give me cold drink, give me rice. There's no, they should help. And when they finish, they should help you clean the kitchen. You're caring for a baby, right? So we should be able to ask for that help. And when we know that it's not convenient for someone to come visit, trust me, it's okay to say, no, I think I want to rest for now. Let's learn how to say those things. It's us, we matter. I keep saying that. And another thing that I have tried, like I make sure I do it. Sometimes when I had my baby, one thing that really pissed me off was everybody that came in, the attention was on the baby. And I'm like, I'm a human being here. Yes, I just had a baby, but I want to feel validated too. So everybody was, oh, your baby is pretty. And some people will be nicely insensitive and say, your baby is even finer than you. It might be little, but the truth is there are some little comment like that that triggers a woman. At that point in time, all she wants to feel is, you are loved. It's okay, like you are loved. She just wants to feel all the love, all the warmth and understanding. So what I do for my own self, what I made to be a practice, because I thought it was really not nice, all the gifts my baby got, diapers, yes, I was happy my baby got them because it relieved some financial stress. But I just wish somebody got something for me, even if it's one face cap, just to say, hey, you just gave birth, I like the way, oh, just take this. I really, because of that, what I do is anybody I'm going to see, as I'm getting something for the baby, I'm getting something for the mom to say, you know what, well done. What do I get? As little, because I found that I started using nipple cream when I was pregnant, when I was having my baby, and I never experienced that nipple crack or gouge or anything that they say, oh, it's painful. I never experienced it for my both pregnancy because I used nipple cream. So I just make sure that, okay, at this point in time, you're going through a lot. What can I do for you? What can I get for you? I know maybe a top will not be good for you right now because, oh, you're going to shed some more weight. So I just make sure I go with something, and I go with a nipple cream. For someone else, it might just be, if you know that your friend likes maybe a particular meal, just get it for the friend and just say, oh, I know you like this thing, so I got it for you. So those are things that I think we can also come in. Yeah, I just wanted to bring that up.
So I'd like to add to that as well, if we have a minute or two for me to add. So two things I wanted to say about that was the practices that Kobe described, that will be very relevant to help the brain trigger the release of oxytocin. And what oxytocin does is it's very strongly indicative for bonding, attachment, secure attachment between the mother and the baby. It helps breastfeeding. It helps the mother feel calm and relaxed. So if there is excessive mood swings going on or excessive anxiety going on, doing something as nice as that for a mom, a new mom, can go a very long way to help them feel loved again. So I think that's it. Thank you for saying that. I'm even going to start to implement that if I have when I have the opportunity. The second thing I wanted to address was the cultural practices piece of it. So that again, for me, the way I'm thinking about this topic will go into the macro. At this point, I don't know how much policies that we're able to impact and affect, but we can affect our cultural policies. We're coming from a culture where our parents, mothers, let me not say mothers, older women pass down some practices that they expect from young mothers. And one of them is, even after you've had a baby, you're supposed to get up and you're the superwoman and do this and do that. And oh my God, no. Um, I can't remember who was talking about men not being aware of their partners having postpartum because they could think and say, my mother didn't have it. How would you know your mother didn't have it? You were a baby. So you're not even aware of what was going on with your mom or not. These are all cultural misconceptions that we have to change, and it starts with us. Again, you're an ambassador, I'm an ambassador, we're all ambassadors. So we got to do better for the coming generation, but it starts with us. We start to change these things little by little, and hopefully we make a better culture, birth experience for the coming mothers. There was also a question about if it is passed down, if postpartum is passed down. I read a research that talked about how good enough parenting is passed down two generations. So if a woman is a good enough mother, you don't have to be an excellent mother. Good enough is fine. If you're a good enough mother, you're able to, the oxytocin that your DNA encodes is going to be passed down to your daughter and it's going to be passed down to her daughter. So the decisions we're making about how we manage this is going to impact our grandchildren. And that's something for us all to think about.
Wow, that's amazing. Thank you, Kobe. Thank you, um, Dr. Joy. All right, so I have a question for you before I went off. Can prayers alone solve mental illnesses? Can prayers alone do that?
The straightforward answer to that is no. Prayers alone cannot solve mental health problems. But the other side of the coin is yes, prayer can help. Again, it depends on how far gone the condition is. If it is severe, no, I would say no. For the sake of that person and their family and their community, no, please get help. I found a quote somewhere that I put in front of me for a very long time. It says, faith is neuroception for the believer. And I thought about that for a very long time. Anytime I sit here, I'll just reflect on it. Faith is neuroception for the believer. What that means is because we have faith and we're praying, that is hope. And hope has a lot of positive energy in it. Neuroscientifically based hope. We try to create hope for clients, our patients, our clients. We help them generate hope because hope can help us move very farther along the healing process. So faith can help us generate hope that can help a person start to get better. But if it is mild, yes. If it is moderate, maybe. If it is severe, no.
And can I add something to that too? I think the notion of just pray about it, you're going to be fine, is soaked in stigma. The stigma attached to mental illness, like you're mentally ill because you've done something wrong, you've done some kind of sin. And I tell people, like, we don't tell people who are sick with cancer to just pray about it. Don't take your medication. Just be more prayerful. So why would we say that to somebody who's struggling with mental illnesses? And I also think, we've heard about, divine healing in the Bible, but also Jesus didn't divinely heal everybody. People still had to go to professionals. They still had to go to doctors and ointments and all that stuff. And God can use the professional to help you get better. And even if you do get healed divinely and you return to the same environment and nothing has changed in your environment, there's a high probability that that condition will return, because we talked about the risk factors that trigger this mental illnesses, the social, the environment, the biologicals, and things like that. So even if you do get healed by prayer and you still go back to the same exact situation and you haven't gotten help from a professional to teach you, how to handle stress, how to say no, and all this kind of other things, there's a probability that you get sick again. So we need to stop this message that we pass on to people who are struggling. Just pray more, and you'll be all right. It's more than that.
Wow. Thank you so much. For you, Kobe, is depression the only sign of perinatal mental health reaction or disorder?
Can you say that again? I think echoing.
Is depression the only sign of perinatal mental health reaction or disorder?
What everyone has mentioned so far, there are different, if I got the question right, because I think I was struggling there a bit. There's a postpartum, which I think Dr. Punto went in depth going through the different types, which includes like the whole broad range of PMAD, which is there's a postpartum psychosis, there's a psychosis, there's the anxiety. I'm just saying it randomly. Anxiety, pregnancy / postpartum depression, pregnancy or postpartum anxiety. There's a psychosis. There's a OCD. Which other one again? What am I missing? Someone comment if I'm missing something. I know
PTSD.
I've mentioned.
Yes.
PTSD, right? So not just depression. It's just that depression and anxiety, or rather postpartum depression and anxiety, are more common than psychosis and PTSD and OCD. But generally, there is some it's when it's just postpartum and it's left untreated, that is when it degenerates up to you get. So it's not just depression, but depression and anxiety are more common, right? Yeah.
Thank you very much. I want to ask you this question, the convener. We talked about initiatives. What are do we have initiatives here in Nigeria of perinatal mental wellness?
Thank you so much, Sabrina. That's a good question. Thank you so much, everyone, for the answers so far. Before I answer the question about initiatives, I just want to share my personal experience with mental health and how, prayers is not sufficient. I think it was in 2018. I don't know. I think God was just trying to let me understand the gravity of what we're doing. And, when you see what we're doing today, that's part of why I am passionate about it. I did have some episode of anxiety and panic attacks back in 2018. I'm a Christian. I'm a minister, a Christian minister. And I tried to figure out what were the triggers, what was going on with me. I couldn't get on the highway. I couldn't go to work. There were days when I'll be at work and I'll have the attack and I would have to leave work. There were days when I couldn't just function because of what was going on with me. I was really scared because I didn't know how far that was going to last. And this was affecting a lot around me. I couldn't go so far. There was a day that I was supposed to go to church for a midweek service. And, I just got on the street way. And I had to turn back because I'll be sweating and shaking in the car. and I would just feel like something bad will happen to me. So I turned back, came back, parked my car, and called Uber. The Uber driver came, and the guy was laughing at me, and he was like, "How can you have a car and yet call Uber?" And no, answered the guy. In my mind, I'm like, "Well, that's none of your business. Just take me to where I am going to." Of course, the guy was an African, and that takes us back to that issue of stigmatization, right? I mind you, I was going to church. Why? And I've always been in the church settings. Why did I have to deal with all of that? I prayed. I asked for prayers. I didn't just keep quiet. I asked for prayers, for my pastors then and all that. But it didn't resolve. It didn't resolve. I started looking for practical ways. And that was where I actually learned about the breathing therapy. And so one of the things that I would do is I tried not to go on the highways. When I drive, along the road, not getting on the highway, when it starts, I'll start that breathing practice. And it was helping me. So just imagine that I didn't look for other ways. Well, I didn't end up seeing a professional because I was assured that it was just for a moment. Well, when it fizzled out, I didn't know. But trust me, there was more than prayers needed at the time. I just wanted to be practical about that. Answering about the questions about initiatives in Nigeria, as we have all heard, there's so much going on in Nigeria. My heart bled when Kobe gave an example of women, having to use their hands to manually squeeze out milk from their breasts. I was like, I mean, in America, for instance, a pump is like a no-brainer, right? It's something that you have free access to. Well, not free, but at least it's like a given that you would have that, even if it's just at the hospital. You can easily purchase a breast pump from your local store, right? And it's not made up. I also just remembered that I have seen a situation where one of my former pastor's wife, when I was in Abuja, and this is Abuja. Abuja is a major city in Nigeria. And so we went to visit a friend who just had a baby. And my pastor's wife was helping another church member who also had a baby. She was helping her to practically, squeeze out milk from the breast. This is why, as Divine Delight Foundation, one of the practical ways that we are following up from this event is to do a follow-up. One of the things we're doing is a newborn kit drive or outreach rather. So we're going to partner with some maternity centers and primary health centers and provide newborn kits to women from low income areas. We also want to see how we can partner with maternities and primary healthcare centers to see how we can infuse mental health awareness into what's that thing called? The visits before the childbirth. I'm sorry?
Antenatal care.
Antenatal care, thank you. So during antenatal care, we know that in Nigeria, for instance, antenatal care is usually a group event. So we want to see how we can partner with them in terms of the sensitization that this needs to come in at that point in the life of the pregnant woman. Let's not wait until she's, done with having her baby before she starts to think about her mental wellness. I believe that if that starts from the point where, before birth of the baby, that can help. The woman can understand these are the things that may happen to me. Some people may not have these experiences, but some may have it. So those are some of the initiatives that we have coming up before this year is over. We will talk more about the newborn kit outreach before the end of the event. I know that Kobe is also doing an amazing work in Nigeria already through the Eden Foundation that she started. They already go out and reach out to women in hospitals and all that. I'll let her speak for herself since she's here. So she can also talk about, you know, the initiative that they have on their end. So beyond just Divine the Light Foundation, Eden Foundation, I do know that there are a few other initiatives that are on there, but we do have some local initiatives going on. Kobe, do you want to follow that up?
All right, thank you very much. So for my something similar to what Timmy is working on, which is the birth kit. For us, we are giving the kit to preterm with mothers in the NICU. So we're specific because of my own experiences. Essentially, or maybe I should go back a bit. So I founded an organization in Nigeria, and it's called Eden Foundation. It's an acronym for Educate, Direct, Empower, and Nurture. So the whole idea is we're working to improve the health outcomes of preterm babies and maternal mental health. So for our preterm baby wing of it, the program of it, what we do is we distribute our Eden Preterm Kit. The kit contains essential materials which are particularly in line with the WHO and UNICEF Survive and Thrive report. So what we do is the kit contains, like I mentioned, contains those items. It has a pamphlet on caring for your mental health and beyond, caring for your preterm baby beyond the hospital. And currently what we just finished doing right now is on the mental health side of it, we just created a pamphlet, and the pamphlet will be distributed to hospitals like something similar to what Abiona is saying, because again, I strongly believe that every mother should be educated on maternal mental health. So because of the distance barrier and because the number of psychiatrists, the mental health professionals in Nigeria is really lacking, we, for now, we're working strictly using the pamphlet. So what we're doing is to make sure that we distribute every hospital. For now, we're starting with just one hospital. That's what we're doing, which is National Hospital at National Hospital at Abuja. We'll be distributing our pamphlet to the hospitals so that during antenatal care visits, the mothers, alongside with other resources they get, they have this pamphlet. The pamphlet includes a brief overview of postpartum depression of PMADs. It includes that, includes practical examples of what mothers can do, some simple examples, and some more like a high overview of a summary of what we just discussed here. Like everything is in the pamphlet. So that's what we're giving out to mothers. Eventually, we'll have we'll have to come up with a process where we're able to actually be there at the hospital and take screening. So that's the stage we're building up to. But for now, we're just focusing on the pamphlet. And I think the question has to do with how can people get involved? Again, there are so many ways people can get involved. I'm sure, Abiona, I think we all have some kind of element of practice, personal practices or private practices. Abiona, for me, is a non-profit. For Abiona, is a non-profit. I think someone is Hopstead, that is Dr. Funto Hopstead, and Joy has a private practice. And again, Dr. Lizzie, for me, I think I can speak on behalf of, there's always a need for resources. Like, for instance, there's always a need for volunteers who would be there on our behalf. There's always a need for physical, not just volunteers, there's always a need for cash donations so that we can expand our services. And there's always the need for networking. So if you know someone that knows someone, networking is very, very important. The more we network, the more we are able to reach a broader range. So if you know, for instance, like a nurse or somebody at XYZ hospital, you can just give us a contact, like connect us to that person so that you believe that this service will be needed there. Yeah, thank you.
Thank you very much for that. That was very insightful. So my last question to Dr. Joy. She said I shouldn't call her doctor, but I bestowed this upon all of you because you all are my doctors already. Thank you. How long does it take to recover from a prenatal mental reaction or disorder?
Thank you for that question. I'll be very frank to say that because that's not my area of specialty, I'm not aware. I don't know. Um, I cannot give you like exact figures or numbers, so maybe I'll
Okay, can we ask?
To someone else who was able to answer that question very specifically.
Okay, let's go to the point. Dr. Lizzie?
So honestly, it really depends on the clients. Typically, postpartum depression and anxiety um, goes through like the first year after giving birth. Um, so that's an interesting question because after that first year, you could definitely still have depression. You could, of course, add to your family and still have depression. So I really think it depends on the client. It's hard to just kind of give like a time frame, like, oh, by this time you will be cured from depression. I really think it depends on the clients and how they are taking care of it, right? Some clients go to consistent therapy every week. Some clients actually, take medication. So it really just depends on the clients and what their treatment plan looks like. I don't believe, and Dr. Funto, you can help me with this, but I don't believe there's like a certain time frame. I do know that it does last throughout the first year. So when your baby becomes a toddler. So
Yeah, I agree with you. And I think also how soon you get help, right?
exactly.
That also plays a role. So if you get help quickly when you start to notice,
Awesome.
and you get help, versus if you let it last long without getting help, all those are factors that can impact, how well you get well, how quick you get well.
So in addition to that, the only thing I'll add is the severity. When we look at the severity, how severe is it? If it's mild, then we catching it quickly, getting help, interventions can be very helpful. But if we're looking at moderate or severe depression, taking it out of the context of perinatal and looking at just a human being moderately or severely depressed, then I'll be leaning more towards what Dr. Lee said, which is the treatment plan, the frequency of treatment, how engaged they are, what other interventions have been added to the person's treatment, and the biology can also play a very huge role, the social environment. So it's very multifaceted. It's not a direct question that is not a question that has a direct answer.
All right, thank you very much. It's been a great time here at this year's seminar, and I trust that all our viewers, our guests, have learned so much. This is my last question to every one of you, Dr. Funtor, to Lizzie, to Dr. Lees, to Kobe, to Joy. What is your takeaway message to our audience?
What I would say is take care of yourself. You got to look out for yourself, and don't try to meet somebody else's expectations for you. I think somebody had mentioned the mask on analogy. You got to take care of yourself first. You can't give out of an empty cup. You got to take care of yourself first, and that's when you can be healthy and be present for your newborn and for your family.
Dr. Lizzie?
Yes, very similar to what Dr. Punto said. I'm a huge advocate for self-care. I actually, talk a lot about self-care and just, the importance of it and how it needs to be a lifestyle and not something that we just put on the back burner. We need to implement it into our daily lives in order for us to feel full and fulfilled. So that's just very important, especially during this period of, carrying life, right? You want to do whatever you can to protect your peace, protect your energy. It's very important because it's not just about you, right? Once you get pregnant, you have to, now think about a life that you're bringing into the world. So it's very similar to Dr. Funto. Self-care is huge and not selfish. It's very important. So that's my takeaway.
Thank you. Joy, take it back.
Yeah, so in addition to that, I will say for the micro system, which is the person who's the new mom, fake it till you make it. Whatever you need to do, start small, push yourself. Um, that could be very pivotal to how long you stay feeling those symptoms of depression. So fake it till you make it. For the people around them and other systems, we have to do better in our community. We just have to do better. There's so many cultural practices that it starts with us, it starts with you, it starts with me. We have to change things around to make it easier for this population to manage this time of their lives and come out of it healthier, with great babies attached, because this is what is going to be pervasive for the community, for the world. It's the unit and then ripple effect. So fake it till you make it. That's for the individual, then for the system. Let's change our culture. Let's make it better. Thank you.
Thank you very much. Fake it till you make it. And of course, smile often. I've taken that away. All right, Kobe, Ajayi.
So again, in addition to what everyone has said, I just want to I always like to close with, anytime I'm asked this question, I always like to close to make it really personal. To the mother out there, just know you're loved, right? It might not look like you're loved. It might feel so overwhelming right now, but you're special. You're loved. It's overwhelming. Sometimes it's easier said than done, and I can imagine if you're in Nigeria right now to look like, oh, you people are not in the country, so you people are not experiencing the hardship. But the truth is, we have families out there. We may not really know exactly what you're going through, but just know that you are loved, your feelings are valid, you are not alone. There is no perfect mom. Like we all showed up out here with our makeups and everything. Trust me, you don't want to see me when we finish this, right? We go back to ourselves. It's so we're showing up when you see us on social media or when you see people on social media. That's the part we want you to see. There's no perfect mom. So you are enough. Your children, what you're doing, it's enough. Don't don't be hard on yourself. The way you extend grace to other people, the way you make excuses for someone else when someone makes a mistake, give yourself that grace and make an excuse for yourself. You're just as human and as every other person. You're loved, you're special, your children love you, your feelings are valid, and you're not alone. You have a host of all of us. You know how many women are in the earth? We're plenty. So we are with you and we're for you. Yeah.
Wow. I don't know what else to say, but I'm really grateful for this opportunity to compare this event with such great minds and excellent women, because you're beautiful, you're loved by me. Thank you all so much for that great time, the presentation, the question and answer segment. God bless you and take you higher in Jesus' name. I'd like to welcome the founder of Divine Delights Foundation, Mrs. Temi Abiono. Over.
Thank you so very much, Sabrina. In addition to all the amazing things that our speakers have said, I just want to add that, charity, they say, begins at home. One of the things that I'd like to say is be your own voice, right? If nobody is speaking for you, speak for yourself. Yeah, speak for yourself. I have found that very, very helpful when it comes to my health. I've been through some very serious health issues. And one of the things that I found that really helped me with the breakthrough was that I was speaking for myself. I was looking for help. And trust me, you may not have a good experience with your first provider when it comes to your mental health. Don't stop there. Don't be discouraged that, because somebody didn't help you the first time and that's the end of it. No, if you didn't get help the first time, look for help yet again. That's not the end of the journey. Keep seeking for help until you get help. So I'll definitely, say that. The second thing that I like to say is, please speak up and speak about this. Speak about it in your community, in your family, in your, organizations, in your religious settings, in your churches, um, even amongst whatever religion you are, you're a part of. Speak about this. Also, when it comes to the policy aspect, we can speak to our representatives. That's why they were elected, right? They need to move certain things for us. They need to help us implement changes, especially, when we're not when certain things are not being done rightly, in our community. We want to speak to those who can actually make things happen. I may not be able to make the changes when it comes to policy, but can I look for the people who can help? Definitely I can. So let's look for those who can help us move, the button from where it is right now to the next button. Who are those that can help us make sure that, okay, at birthing centers, in the hospitals, in the maternity centers, we're having access to breast pumps, you know, women are being taken care of. Mental health is being included in antenatal visits and postnatal visits. So we want to look for those people. We want to speak to them. We want to look for those changes and sort of request for them, right? The other thing that I'll also say, in addition, is please stop the stigma. Mm, yeah, stop the stigma. We're quick to stigmatize. In Nigeria is a place where we stigmatize a lot, a lot, a lot, and it really needs to stop. Don't Because you were strong when you had your baby doesn't mean that I have to be as strong as you. And don't compare yourselves to others. That's how you can actually show support and love. So love others, be kind to others with your words, with your actions, right? It's okay. We are all learning. So if you have made mistakes in the past, let this be a call to action that you're changing. If you've been harsh with your words to others in the past, let this be that you're changing. I remember that my immediate older sister, actually had serious postpartum depression, and I didn't know. I always feel bad when I remember that I didn't realize that my sister was having postpartum depression. And it was so bad. And everybody thought that she was fine, but she wasn't until she spoke up and said, I was in a mess. I'm glad she's doing okay now. We want to be sensitive. We want to know, what's going on with the people around us. Thank you so very much. It's been a very, very interesting time to learn today. I'm just hoping that you were able to take out one thing or the other from this sessions today. It's been very educative and very, very helpful. Like I mentioned earlier, Divine Delight Foundation has an upcoming project. We want to reach out to, please, if you can help me put up that information. We want to reach out to women in Nigeria, especially, or precisely, not especially, we want to reach out to women in Nigeria with newborn kids over the next few months. Our first project will be out in August. By God's grace, we're reaching out to some women in Ogun State. And then momentarily before the end of the year, we're going to also reach out to some women in the north, most likely in Plateau State. We're just still working on the logistics of that. If you would like to partner with us by volunteering, I am not presently in Nigeria. I live in Minnesota, and I work here. So we definitely need to have volunteers that can help us deliver this and make this great. So if you'd like to volunteer, if you would also like to donate your funds towards this, we already have some businesses joining forces with us to make this a reality. We would greatly appreciate you reaching out to us. You can definitely send us an email to divinedelightfoundation@gmail.com. You can email us at divinedelightfoundation gmail.com for more inquiries about that. Um, so, and like I also mentioned, one of the things that we want to do is also to see, if we can get providers who will be willing to so mental health providers I meant, who will be willing to give pro bono sessions when it comes to mental health education, especially when it comes to perinatal mental health. We're seeking collaboration with mental health providers. What we want to do is that we want to access maternity centers and primary health care centers to find our own little way. We were recommending for us to speak up to make the change. We want that change to be us. So yeah, and of course we need a lot of goodwill and prayers for all of this to become a reality. So yeah, please send all of those our way. On that note, I really just want to appreciate everyone who has contributed to making this event a success. Um, First and foremost, I really want to thank every member of Divine Delight team who have been working for several months. Yes, this was not just something that we started last week or last month. So for the hiccups that we got yesterday and the hiccups we got today, those were not meant to be. Those were not intended. Those were not because we were sitting and folding our hands. We've really worked so hard. And I thank everyone who has been on that team. Thank you for your dedication and your commitment. You're very, very much appreciated. Thank you. And I really want to also thank my facilitators today. Oh my God. Thank you guys so very much. Dr. Funto Oyewale, thank you for accepting to be here with us today. From the very first day that I reached out to you, thank you for helping us, even when it was looking like, oh my God, things were not working. We weren't getting enough facilitators. I know that you guys will believe that today we had at least good seasoned facilitators in the room. Thank you for joining us on very short notice. Joy Jagete, I really appreciate your passion, your flexibility, and your acceptance to join us. Thank you so much. You're not taken for granted at all. Thank you so much, Kobe Ajayi. Let me tell you guys, I actually found Kobe on Instagram. That's how I came across her because her foundation followed my personal page. And I was like, okay, all right. From researching what the organization was about, I found the person who was behind it. And I did see that she aligned with this project. And in less than about 2 weeks or so ago was when we connected. And I really appreciate you for being flexible and being committed to this. Thank you so much, Kobe. I appreciate you. Dr. Liz Adedoko, we go way back. Thank you for joining us again this year. She was with us last year and she's been amazing. When she saw this on very short notice, about last week or so, I think was when she saw this and she's like, I really want to be a part of this. This is my passion. And, we just found a way to make it happen. And she did come with her A game. Thank you so much. We're very, very grateful for having you join us. Thank you. I also really want to thank Mayo Clinic for sponsoring this event as well. Mayo Clinic has an initiative called Mayo Clinic Global, and Mayo Clinic Global is an initiative that reaches out to organizations at different levels to not organizations, rather communities outside of the US to educate and to sensitize and to help even providers and also to educate and sensitize on the community levels. And they found this project and this seminar today, this work that we are doing, they found it worthy to be sponsored. So we really thank Mayo Clinic for joining us on this. Thank you, Mayo Clinic Global Health Program. Thank you. And we do have some representatives from Mayo Clinic joining us today as well. We appreciate you. Thank you for joining us. Thank you for helping on the background, Sarah. We really appreciate you. Thank you. Thank you. Thank you so much. Thank you to everyone who has donated in the past and in the present to make our project a reality. We're moving one project at a time, doing what we can from, the small levels. We're taking little steps. And, our aim is not to change the world at a time, but we will do it one step, one project at a time. So we believe that this is one of it. That is one of the little projects that we're doing at this time. Um, I really just want to thank, especially my husband, for supporting me, for releasing me to do this, and for helping me like do this amazing. I just really want to say thank you for that. You're amazing. Thank you for helping in all the ways that you have always done. Thank you. Thank you so much. Thank you for everyone. Thank you, everyone. I know my parents are on here as well. They're watching. They've been cheering me on, and I'm so grateful for you all. Thank you for supporting this little girl. I just want to say thank you to everyone who has joined in today. You all are amazing. Thank you for believing in us. I know we are just little and small, but you believed in us and you have decided to join us. Thank you so very much. We really appreciate you. I want to also say thank you to whoever I've not said thank you to. That's the issue when you're mentioning names, right? Thank you also very much for everything. Thank you for joining us today. It's been such a blessing to, and such a great delight to have you join us. If you have any questions or you need any information, please reach out to us by email at Divine Delight Foundation at gmail.com, and we'll be prompt to respond to you. Thank you so very much again. Have a good rest of your weekend and stay well, stay healthy, love yourself. We love you. Have a great one.